At 1 o'clock, call the Board of Supervisors into session. We have one item on the agenda for approval, which is the transfer of funds from the ARP funds to the general basic account of the county in the amount of $10 million for the lost revenue.
Hi, Harley, it's Stella. I can talk a little bit about this and lead this work session if you'd like.
Yep, go ahead, Stella.
So the board expressed interest in having this work session when we met on Monday to talk about our external ARPA applications and kind of where we're at. And so we put together this resolution for consideration by the board today as part of the discussion. So when the federal government passed the American Rescue Plan Act last March, I believe, we were given some temporary guidance. So we've been operating under that temporary guidance since about May of last year. The final regulations came down the first week in January. So in those regulations, they specified that counties can take a loss, so lost revenue to the county of up to $10 million. So that's kind of the standard allocation. So this resolution would be setting the allocation at $10 million for Dubuque County. So it doesn't mean we're doing anything necessarily with the funds yet. They stay in the ARPA fund balance, but we're allocating that money to the lost revenue. And the lost revenue then can be used for any county services. So that's the main idea behind the lost revenue. Many counties smaller than us don't necessarily or didn't necessarily have ways to use their ARPA allocation under the ARPA funds. And this was pushed heavily by NACO to move this route. So the federal government did take that recommendation and add that to the final regulations when they came down. So that's where this resolution came from. So we'd like that consideration by the board today to do that allocation. The first quarterly report for Dubuque County is actually due by the 31st of this month. So I'll be working on filing that tomorrow. That reporting period is from March when the bill was passed through December 31st of 2021. So we'll have no activity to report on that. Other than if you pass this, we can start adding things like this into our reporting. And as the board continues to make decisions regarding the funding, those will go into our quarterly reporting.
Okay. Any questions, Jay?
I do not have any questions.
Ian, do you have anything?
Yeah, I'm not supporting this resolution. I'll be voting no. I think it's circumventing the purpose of all of the pending grant applications that we have. And I think we don't have any numbers for our lost revenue. We don't have that in front of us. We certainly don't have $10 million in lost revenue. I understand that this is allowable. I would not prefer this. My strong preference is to not proceed this way. I think we need to work through the applications that we have. The thing that is unspoken here today is that it's my understanding from talking to two members of the team who drew this up that we would spend $10 million on payroll, not payroll retention, not payroll increases, but we would allocate this $10 million for ease of reporting to payroll. And I think that that's, I just totally disagree with how this might proceed.
Okay, my understanding was that these are still ARP funds. We're just putting it into the general basic, that it can be paid out to whatever we decide to allocate funds to, correct, Stella?
So it doesn't actually move into general basic. It keeps the ARPA fund balance. So we have to spend that money. We can't sit on it. We can't transfer it into general basic and replenish our funds. We have to actually use it for government services. So any revenue loss still must be used under the time period for our general government services.
Okay, I must have misunderstood you because I thought we were transferring that into,
Nope. So some of the things we have discussed would be processing payroll. So we would process payroll through the ARPA fund as opposed to other funds as a allowable government service. It can be used for any government service that we provide. So it became less restrictive under that final regulation. I shouldn't say less restrictive. They changed the standard allocation. So previously under the temporary rules, there was a revenue loss calculation. That still exists, although it's been changed to increase it, in fact. So we can calculate our revenue loss and take that if it is greater than $10 million. So if we calculated revenue loss of $11 million through that calculation, we could take revenue loss of $11 million. But the federal government came down with that standard allocation. So I think it will be very commonly used across the country.
Stella, who was involved in kind of, coming up with this concept to allocate the $10 million related to the guidance that you've received?
Sure. Our ARPA working group is myself, Auditor Dragato, Ed Raber, and Dawn Sherman.
And
So
there was consensus among the group to support this plan from all four of us.
Okay. Yeah, I mean, thank you for doing that. I know that's kind of what the Board of Supervisors has charted you to do, is to review the guidance and to guide us through these application processes from day one. And it's been a learning curve for all of us. And it would have been nice if we would have known this roughly 9 months ago. But the final guidance just was released within the last 30 days, 60 days.
first week of January. Yeah,
First week of January, so very near term. And so, as someone who has funding in my other position with both local, state, and federal, and Supervisor Potoff, you've probably experienced this over your years working for the county. Many times there are multiple funding sources, and there are different rules for each one of those funding sources. But generally the client, the citizen, or the end user is usually not too keen or aware of all the different regulations, or doesn't even really concern themselves related to those buckets that they come from. They just, want the service, they want the delivery. And so I think we're in that same type of position here. And for me, we're already doing this type of thing with our local swap funds in the transportation sector. So the small cities can receive up to $25,000 and have a project that's not, have guidance with federal oversight. And why do we do that? Well, it just makes sense. You don't need to burden yourself with all the federal oversight related to those individual projects. So we already do that, and we think it's a great thing, and the small cities think it's a great thing. So similarly, I'm very supportive of moving the $10 million that the federal government has allowed us to do into this separate fund. At the end of the day, we still are going to review each and every ARPA application, hopefully sooner rather than later. I've been a proponent of that. And we'll review them on their individual merit for community involvement. And we should review them under the guidance of that funding mechanism that came in. And ultimately the board makes decisions on those applications coming in. So I don't see it changing the outcome. I don't see it changing the applications, or even changing our process that we would do for at the board level of vetting the application and determining the priority and the funding for each one of those applications.
I think the difference, I think the difference is that the taxpayers are watching, and whether you put money into swap funds or not with the DOT, that all gets lost in the weeds. This is a high level macro that I think people understand. We've been given nearly $20 million to address the response to COVID, and transferring $10 million to a budget account that is earmarked as making the county whole for budget loss that isn't accurate is false and shouldn't happen. We can work on our numbers and be transparent about how those funds should be allocated for lost revenue. It isn't $10 million. We don't know what it is, but that's a number that's knowable, or at least much more knowable than this. And I would suggest that we continue to work on that. And then secondarily, the idea that we would spend this $10 million on payroll expenses because it's a government service is disingenuous. It isn't what taxpayers expect of us. And so that's why I'm voting no. Could this happen at a future time with more discussion and greater transparency? For instance, some of this money could be transferred to use for specific purposes of some of the smaller items that technology just raised with us that are also could be funded by ARPA. We could transfer funds for specific purposes. We could make those decisions as we go along here. But this resolution, I think, is misguided. I understand that the team wants to get us somewhere, but I'm not joining in this today.
I believe your words are misguided. I think we've entrusted our team, and they are individuals that are elected by the public and also have advanced degrees and have studied the rules that the federal government has provided us. So words like false just don't fit. So, you know, I fully intend, and I hope my colleagues would support this, that all $19.8 million that we received will be spent in full compliance and guidance with all of the federal rules that came down from this. That's fully my intent. This is just a mechanism internally to allow that to happen much easier. But if you want to take the hard way around and you want to have additional costs and burden, then, you know, run everything through every minutia through all of the federal processes, and that's what you're going to get. This allows it to work for the local government and our individual budgeting. And that's better government, that's efficient government.
This is Auditor Dragato, if I may, just as a point of clarification, the suggestion that this $10 million would be used for payroll would be a mechanism to increase then by $10 million the balance we have in our general fund, because that would be payroll not coming out of the general fund. So it is in many respects a way to allow us to offer ARPA funding dollars to entities that may not qualify to be a subrecipient, for example, or entities that we don't deem are able to meet the reporting requirements. And it would also allow us to have that flexibility in how we allocate the dollars. That's the rationale and the thinking that came out of our group yesterday.
Okay, and that was my understanding, that I said we're putting it into the general basic, but basically we'd have that money in general basic where we could pay out the ARP funds, and the entities that would receive the money would have less restrictions than under the ARP funds.
The restrictions they would have would be the same restrictions we have as a county when we operate any program we have. The entities would be answering to us instead of answering to us and the federal government as a subrecipient.
Correct.
It's 6 of one, half dozen of another. The $10 million is still there to be spent. Just under the Treasury guidelines, we would be using it for a government service, and that satisfies our requirement. So that's sort of where we arrived as a group. If that's correct, Stella, if you concur.
Yeah, I think what we're trying to get to is that we would allocate this 10 million to our revenue loss, but within that revenue loss, we would hope to maybe today even get to an allocation from that revenue loss to the external applications. So where would the supervisors like, the question is, where would the supervisors like to go with their external funding? Would you like to set an amount to that from the revenue loss bucket?
I would like to not report to the Biden administration that we've spent $10 million on payroll. That's what I would like to not report. I understand that that's a simple entry, but I don't think that I just don't think that's transparent. And that there's federal regulations we have to comply with. Well, of course there are. And there's good purpose for that. And this is how we're going to kick off our ARPA funding, is by transferring half of the money to ourselves. That's what it looks like. And that's what it seems like. And I don't think that's transparent. So for today, I'm a no. As we move along this, maybe this will be time for that. But for me, it's not today.
I'm very, very pleased. We have a survey. We've asked the community what they want. We went out for applications. We've got the applications in front of us. We have the dollar amounts and the applications for ARPA funding. And this mechanism would allow us to review every one of those applications and prioritize and fund. Just like we said we were going to do, just like the initial guidance said was okay to do. I love the Biden administration, but I'm not too concerned that Uncle Joe's gonna think that we're doing anything wrong here. I'm sure he would pat us all on the back when this process is through and say, good work, way to listen to the community, and way to deliver these funds to the community. That's what we're doing.
Right. There's nothing that requires us to do this. Isn't that true, Stella? Nothing requires us to do this. It just makes it simpler for us to do things that, in my opinion, are not as transparent. And the reporting to the federal government wouldn't reflect what we're actually doing. It would just be payroll, 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 payroll to spend down $10 million. That's not the intent of the program.
So I think there's two things, two separate issues kind of being discussed at the same time. There's the allocation of $10 million and then what to do with that allocation. So I think the resolution is just establishing that allocation. The discussion later or further, not really today, would be what we want to do with that revenue loss allocation. So it's mostly a standard allocation, kind of like a standard deduction on your tax return. Are there any other questions regarding what that means or this piece of the program itself?
I guess I understand Dan's point. It does look like we're taking 10 million of the money, but in essence, we're not. We're using it as payroll, but we're still going to have that 10 million in our general basic, which we would fund the ARP funds out of, and they would purchase a service grants or whatever you want to call them through the county instead of having the federal guidelines. For some of the entities that would not probably qualify under the federal guidelines, we could still fund them with the ARP funds under the county guidelines.
Sure, that would be one proposed usage of it. I think what we need to be clear about is that this resolution just establishes the allocation. It doesn't transfer money. It doesn't move money. It still stays in the ARPA bucket, I'll call it. And the board will make decisions as we move along of how that money is allocated within that bucket. So it still will be reported on. It will still be decided on by this board. It doesn't just automatically go to something. The board will still need to make the decisions on how we spend that allocation of 10 million on government services.
Are you suggesting that you will bring back to us the idea to spend the money on payroll for ease of reporting? Or is that all part of this resolution?
That is not part of this resolution. That is for further discussion as we move forward on funding. decisions. So this is just a standard setting of the allocation.
Could we just take no action on it, Stella, until we had further discussion on it?
Certainly, there's no action required. One of the things that we plan to do, we'll be presenting resolutions anytime there's funding considerations for ARPA funding. So you can take no action, you can table it, you can do whatever you choose to do. We will, I think, continue to recommend a standard allocation of the $10 million per the government regulations.
Supervisor Potoff, what's your concern
So I mean, I understand Ann's
today?
take that it does look like we're taking 10 million. It doesn't look very transparent. I understand your aspect of it very well. And we have 4 staff members that have worked on this that obviously are very up on the rules. So I tend to stand behind the team that put this together. I mean, I think it's pretty clear what's happening with it. Because I can go either way if we want to table it for further, or if somebody wants to make a motion to approve it, or
Yeah, my vantage point is I certainly respect the staff and elected officials that put this together, and it wasn't fly by night. They've been studying the regulations and the guidance as it's come out. And so, that's a lot of brain power reviewing that. The other thing is, we are elected by Dubuque County citizens, on local ballots. I am not a federal official. I'm very pleased and happy that the federal government provides us with funding now and then. But I think it's our responsibility to act with the lens of local government and act with the best intention of those we serve. And all those individuals that submitted applications for American Rescue Funds in our internal applications, we should be looking to figure out ways to fulfill that, not to put up higher hurdles and unregulated burdens on us. And so when our professionals tell us this is the way to proceed, I believe them. And my experience in government leans me that way as well. We shouldn't act like the federal government. We should act like local government, because my 30 years in working with government is that local government is the most effective and the most efficient. So I will make a motion to approve the resolution as presented.
I will second that. Have a motion and a second to approve the resolution as presented. All in favor signify by aye.
Aye.
Aye. All opposed, nay.
Nay.
Resolution passes.
Sorry, I was
is-
muted. I think the further discussion, though, as part of this Board of Supervisors discussion, is the external applications and how the board would like to proceed forward. So is there interest in getting to an allocation of external applicants in the ARPA funding, either through the ARPA piece or the revenue loss piece? And we as a group categorized the external applications under the different funding availability or the different usages under the regulations. So supporting the public health response, addressing negative economic impacts, investing in infrastructure, or providing premium pay. So we could start either is there interest in making an allocation A, and then B, can we start bringing forward some of those buckets to you for consideration? So maybe starting with supporting the public health response, that bucket of applicants, starting to bring those forward.
Well, I'll make a motion that we deny categorically all of the requests for premium pay for essential workers from the external applications. That's $1.5 million of funding to specific entities that wish to pay their employees more. None of those are county employees from the sheriff's department or from Sunnycrest. And I think, you know, acting as though those are considerations that we might actually be engaged in, I think we could give some clarity to the community that we're not doing that. We're not giving outside some folks in the community a premium pay from our limited federal funding. So that is my motion to deny. There are total of 5 applications, I believe, that are in that category. Dubuque Community YMCA, YWCA, Marita Tyson Child Care Center, Hillcrest Family Services, Hills and Dales, and Mount Pleasant Home. All of them asked us for assistance in compensating their employees, and my motion is to deny those requests.
All right, well, so sometimes we're quick to jump on a yes, quick to jump on a no from both for our different chairs' perspectives. I wasn't prepared to dive into each individual application today. I've been a proponent of moving forward, getting the board to do that, but I don't think they're on the budget or on the agenda right now. And so
I think
to approve or deny any one of the applications on without them literally listed on the agenda, I'm not.
Well, this is the auditor. I think we have the flexibility and latitude to do that. And I believe, and I'm going to cautiously speak for the group of 4 individuals, that we would support the not moving forward for essential pay, premium pay for workers. There are a number of reasons that we can discuss if need be, but I think that's where the group would be as well, just for that bit of information. But I don't think there's any procedural issues with taking that motion and considering it.
So in the same course, we could make a motion to approve any other application?
Absolutely. I mean,
Without even being on the agenda and listed?
we have the agenda item as ARPA Board of Supervisors discussion.
Agreed, and then the resolution underneath is lost revenue. So I would prefer to have the listing of at least the applicants, or at least that we're going to list the applications and review and make decisions on those. I'd like that to be part of the agenda. I think that's kind of transparency, that you're saying, hey, here's the applications are coming in and we're going to make a decision on them.
Luckily,
I happen to agree with the position, but it's more.
Well, we have a mechanism in place for that, and it's that there was a motion made, and if it's not seconded, then it will die for lack of a second.
I agree. Yeah,
That would be your motion. That would be your possible way of moving forward without taking any action then. So you do have a motion on the table.
Well, I agree with Ann that I do not see this as a viable expenditure. And it's a way to keep things moving forward a little bit. I understand Jay's point that the ARP, there is discussion regarding that. So I will second the motion to deny the pay for essential workers. Have a motion and a second. All in favor signify by aye.
We have a little more discussion.
Oh, sorry.
Just a little more discussion. So yeah, as I look at, and we've got, I forget off the top of my head exactly how many applications. I'm sure somebody could tell me, but it's, in close to 90 internal and external. So I don't, off the top of my head, claim to be an expert on all 90. I have reviewed them all over the last 6 months. I just, I agree with the position you're taking, but just to jump in and start to carving ones out, and then to, then can I jump in and start making motions to put ones to be approved today? That just doesn't seem like the process that we were attempting to follow. Although I've been critical that it's been a little slow, it just seems now we're like all of a sudden, oh, okay, this one's out. And, we've started without really telling the applicants that we've started. I'm not a big fan of that, but end results and local government being efficient, I will support the vote as we move to it. But just want to hopefully we don't do this more often. I'd like the applicants to be listed. The ones we are going to be reviewed be listed on our agenda so that they're aware and can tune in and can hear our discussion. These people on the list, the 1, 2, 3, 4, 5 groups, they're not aware that we're going to decide this today. I never told them. I told them it was going to be a couple more weeks because I had no idea we're going to do this today. But I agree with the concept and I agree with the final decision that of not funding them. So maybe the ends will justify the means in this case, huh? That's my
Yes,
last words.
I think there was discussion early regarding the premium pay with some of those entities that there may not be support for that. So I think they already knew that there probably wasn't going to be support on it. I don't think it's a big shock to anyone personally. Do you have anything further, Ann?
The concept of premium pay was discussed with several articles in the Telegraph Herald. We talked about this when we were looking at mental health funding and our Fund 10 balance. So I agree, Harley, it's been known out there. I don't intend to contact each nonprofit or each governmental entity as they come up on our agenda. This is a category that we should put closure to.
Yeah, they just didn't know it's today and they didn't know we were going to talk about it today. So they're probably not tuned in. And, you know, that's the purpose of an agenda. So we're kind of skirting that. And, you know, it's $1.5 million, but but no, it seems like we have a consensus. So those are my final comments.
Okay. Have a motion and a second to deny the premium pay for essential workers. All in favor signify by aye.
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 I will abstain.
And Jay abstains. That'll pass to.
Can I ask what the purpose of the abstention is?
Supervisors, I have to reference some code here, but I'm not certain that you can abstain. I believe you have to have an aye or a nay vote.
It'd be new. If you could research, that'd be great.
I think there has to be a reason for the abstention.
Well, I believe each one of us, I don't know about you, Supervisor Potoff, but I know every one of my previous board members have abstained at one point, but I would move on. Would be my advice, unless you want to stall on this issue. You have a majority.
Of the majority, I'll refer to the auditor as
Yes, we can move forward. If there are any issues, we'll have to bring it back to the table, but we can
Okay.
move forward with the two.
okay, thank you. Is that all we have?
I think really the next question to the board would be, is there interest in an allocation to external applicants of our 18.9 million? There's been discussion surrounding that at some level. And then what would the next step the board like to see? I think we would propose putting a work session onto regular meetings to start tackling these buckets, supporting the public health response, addressing negative economic impacts, and then investing in water, sewer, and broadband infrastructure. So to kind of tackle them as a bucket at a time, potentially.
I can give you some input on that. I'm not going to make a motion, so Supervisor Wickham can be comforted by that. I would like to have some more information about the infrastructure requests, specifically related to all of the other infrastructure bills that have come, the state and the feds. There's been a lot of other action about that. I'd like to know, these applications are old. We've all agreed about that. But I wouldn't mind having an update just generally from, not necessarily from these folks individually, but from our people, from Ed Raber, from Anthony Bargett. Let's see if ECIA knows something on these categories. Is there any other funding available to them? Let's try to get a high level response about that before we go into, this is my opinion, into the specifics of some things.
Certainly. Sorry, just making a note to myself. Okay. So we can start to work on other potential funding sources and different federal guidelines that have come down on infrastructure.
I think there was one supervisor's comment. Could you repeat your question you had back to us, Stella? What were you proposing?
Sure. So the first part would be, is there interest by the board of setting an allocation to external ARPA funding applications?
Okay, so a dollar amount saying, hey, let's
Yes.
generally try to get some overall budget appropriations for this estimates.
Yes.
Because the total amount of external, I believe, exceeded all of our funding. Is that correct?
Correct. Yes.
I would generally be in favor of that. I mean, I don't, we have future, we have internal needs, and we have our current applications. I did not anticipate spending all roughly $20 million on external applications. And now that I've reviewed them, I have a general comfortable level. My number would be probably less than 5 million. So I would be interested in trying to define that.
I guess what I'm asking for, Chair Potoff, is some more education before we look at even buckets. I think we might need to see the passage of time. One of the categories is invest in water, sewer, and broadband infrastructure, both external and internal. For educational purposes, I'd like to know what other revenue sources they might have discovered or that are foreclosed to them, that are not available to be used.
Right, but regardless of the other sources, I think we still need to say, well, Jay's saying under 5, I would be in that 3.5 to 4 million range as, for the external. And I had done a worksheet for Ed, which I don't know if he forwarded out, with just the way I had broke it down. And we'd set the same for the internal.
Right. And what I would like to get to with my colleagues is, in my chicken scratch on my worksheet, there were a lot of goose eggs. There were a lot of negatives that I wouldn't vote for. As the president of a foundation, I have voted no on multiple occasions. I don't think we want to go into this in kind of I'm going to use a word that maybe isn't appropriate, but a socialist manner. There are going to be applications that are going to be flat out denied and likely should be. So if we get to X amount of dollars, we were going to spend $5 million on external applications, and then everybody gets maybe 10% of what they asked for. That's a great disservice. We have to be ready to say, no, that doesn't fit the same need of priority. And so further education before we give a number that we're going to hold ourselves to, I think is wise. To say, let's start looking in who else might have other funding. Maybe it's a little less action oriented, but it still is, in light of the very, very limited discussion we have had as 3 people. We've had no discussion really about what might be priorities and what might be essential needs we wanted. We're just categorizing things by some way so our job gets easier and maybe less difficult. And I don't think that's what we should be doing. We shouldn't just be setting a number because we're going to further subdivide that, and then everyone who applied is going to take home a participation prize. That's not a good way to go either. And that's what I fear we might be headed toward by giving some kind of number. What is the number based on? And maybe there's or maybe only one external applicant that's going to be funded. Maybe there's 12, I don't know. So we haven't had that kind of discussion, and the time for discussion should be given to ourselves to do that.
Yeah, I was a proponent to prioritize and categorize from day one. And so I'm still there, but that won't change the fact that we have these applications now that have come in before that process. So this board decided to do a survey and have a general open call for applications prior to the public knowing what our prioritizations are and what types of categorizations we're going to provide for this funding. So I think as they say, the horses out of the barn. So I would like to move towards the applications and review them on their merit and assign a dollar amount, yes or no, to them. And go through that process. And not all of them have to be here for 15 minutes or half an hour. Some are small and very modest asks. But the board needs to review those applications, have discussion amongst ourselves, and make a decision. That's what we asked the community to do. And so I think we need to move to that.
Supervisor Wickham, are you suggesting that everyone should come in? Everyone should make their
No,
presentation before us?
No, I think I said the opposite. I said, I don't think everyone needs to come in. Some of the requests are modest and can be understood without a 15 minutes or half an hour interview or back and forth. Some of the requests are very dynamic and new and in depth and probably would require that. And so I think that's kind of our next step, is to say, okay, as we look at these external applications, these 6 or 15, are pretty complex and new, and we probably should have face-to-face discussion on them, or at least, Zoom and or face-to-face. Others that are pretty small and in nature and understandable probably can get a yes, no from the board without that level of review.
And we don't need to set aside a certain dollar amount to do that. We
We don't
can
necessarily have to.
certainly,
No, we don't have to. It just kind of makes it easier to keep score. I was a proponent of, categorizing. That's, you categorize internal, external. You could categorize new dollar amounts. And so I think that's kind of my thought process at this point. And so it goes back to, for external, I've come, looking kind of our internal applications or external applications, potentially new funding opportunities. That brings me to my, $5 million mark for the external applications. And I'd love to start reviewing those in public.
I would definitely like to move forward with it also. Obviously, there's going to be a lot of no's, and I'm aware of that. We have $66 million in requests for roughly $19 million. So there's going to be a lot of no's. But we have to start somewhere and start moving with it. We have the guidance now. So, I mean, do we need to set a limit on it? No. I just think it would make it easier you'd have, okay, at least you have some guidelines where, okay, we're not going to go over this amount. So what can we fund with that?
we could begin to ask people that are new or novel that we've not heard from. We could ask them to come in, and you could certainly do that. The Fair Association is working on some big projects. If they're ready to share publicly, they could be a partner to come in. They meet the criteria a lot of different ways. And that would be one that it's certainly not same old there. They're working on they have some need, and that would just be an example of someone we might hear from. I also think, the National Mississippi River Museum, that's a new idea, new request, high level. I mean, my criteria has been from the beginning that I'm looking for things that are change, where you say, because we spent this money, that's what happened. And so it's always lended itself to big ideas, proposals that are outside the box, that are change agents. You can look for that impact to exist for years going into the future. That's been my criteria. So, that's how I've looked through the list in terms of inviting people to come in and share, maybe, especially, the River Museum, that's an outside the box thing they're asking us to partner with.
Yeah, I'm ready to have them come forward, and I would like the team that does not have applications in to structure that for us. Because we all have our passions, our loves, and our advocacies, and number and order of when you come in is important. So I'm ready for that, and I would like the team that has been doing this, Stella Rundy and Don Sherman and our auditor, along with Ed Raber, I believe, is part of that.
Yeah.
Kind of arrange those for us over the next series of weeks, and yeah, let's let's hear those people that they think have those new and novel ideas, and let's make some decisions.
The way I went through it was looking for the ones that are going to affect the most people is how I was looking at it. Trying to reach as many people as possible with, you know, with help. So,
Well, and Harley, some of these have changed. I mean, I know that maybe it's only a small handful, but organizations that have reached out and have said that they've that their need has changed. One example would be the food pantry, the Dubuque food pantry on Jackson Street. They're moving to a new location. So what they've proposed to us isn't probably what their request is anymore. So there's a need to kind of update, you know, where is the program? What is their need? And I am not asking for everyone to send us an update, but I do think that the team you speak of certainly could be in contact with them to say, I mean, I did this for the Fund 10 things. This is this particular funding source. Is this work that you do? Is this work that you need assistance with? And so I think we could do that to some extent and help that they could help prioritize. Community Foundation has several things pending here. If there's only going to be $5 million set aside for external, their applications, maybe they should pitch their #1 priority. Maybe there's some more work to do with regard to folks who've submitted multiple requests.
And I think those are the ones that are complex and new, and you would want to give them an allocated time in front of the Board of Supervisors. So whether that's 15 minutes, half an hour, hour, yeah, let's have that team arrange it similar to what we've done. We've done this multiple times on our purchase of service. We did it with the Fund 10 grants as our Fund 10 funding source through mental health. Let's do it again.
I would be agreeable to that. So we could set that up over the next few weeks to start, have a session, work session each meeting to go through some, and we got to move on it. I mean, we have to do something.
And I also, you know, and some things to be said, some of these folks you might go back and the team could say, you know, there's going to be a limit that's going to be given to external applicants. You know, I mean, if we give you 10% of what you're requesting, is that helpful, or is that, you know, not able to achieve the goal and it wouldn't be funded toward the mission that they state? There's some of those in here too, where it's like 10% of their dollar amount honestly is not going to be helpful. They're not going to be able to move forward with programming. That will have to just be used for maintenance. I don't know. So that there's, you know, these were never intended to all have, they were not all working toward the same end. So we just put that out there and to see what we got. And that's certainly what I said. That's what I wanted to see, big ideas from the community. And some of those things just aren't big ideas, I guess.
And I think where I come up with the 3.5 to 4 million, you came up with 5, was the total request where I believe or 66 million. The in external request represented like 25% of that. 25% of that come down to the 3.5 to 4 million. That's how I kind of broke it out, what percentages for each. That's, but I mean, we'll move forward without having a set limit. I know we can do that. I'm not concerned about that really. We just need to talk through them and decide which ones we're going to support and which ones just are not going to make it.
So do we want to let the 4 folks who've been meeting on this, including one elected official, do we want to just have them? I don't mean to say just, I mean, I know it's a lot of work to reach out to these folks. I mean, I don't know why Stella would be doing this work. She's trying to manage our budget, and our HR director, I'm not sure why she's doing this work. You know, there's a lot of HR things that are pending. So I think some of this should be recognizing that we need to bring a few people on maybe to every meeting. And as Supervisor Wickham said, there's something to be said for when they come on. Quite honestly, with such a limited dollar amount, I don't know that it matters. We're going to hear from great projects today that will spend millions of dollars, that are internal applicants. So, everyone just needs to know there's not enough money at all to cover even 10% of these requests.
Do we have understanding on the issue and not?
I
move
think
forward?
we have understanding to move forward. You're comfortable with that, Kevin? We'll start setting it up where we have when people come in, we start going through the externals and we're gonna.
Yeah, absolutely. And the point of clarification for the earlier motion, it will carry. The 2 votes are good. The abstention is also good, but CJ and I will be releasing guidance on his interpretation of this code sections to all 3 supervisors for any future issues that may arise. So
So
thank you for your patience.
We'll have guidance on abstentions and how they can be used.
Correct. With a 3-member board, it's a lot of the code and interpretations are they don't matter with a 3-member board. It comes into play a little more with a 5-member board. But in most cases, and the guidance will determine whether this applies to this specific motion. In most cases, an abstention is recorded as a nay vote. So that's what we're going to get some guidance on and some interpretations from the county attorney, just so everybody's aware of where they stand.
Okay.
Excellent. Excellent.
you,
Thank
Kelly.
you.
Are you good with that, Stella?
Yes, thank you. Great discussion, everyone. So I think the next item up, we'll start our budget departmental presentations. So first up, we have the Board of Health. Is Samantha in the room? So you're standing.
Can you hear me okay?
Yes.
Okay, perfect. And Tom Beshin is going to be doing a few of these slides too, if he's able to be unmuted.
Sure. I'm going to share the screen and start the presentation for you. So just let me know as you need the presentation advanced.
Okay, thanks. Okay. Good afternoon. I'm here on behalf of the Board of Health and Dubuque County Health Department. And this is our FY23 budget presentation. Go ahead, Stella. The mission statement of the Dubuque County Health Department is to protect, promote, and enhance the health and well-being of all people and the environment in Dubuque County. This is done through assessment of the community and environmental health status and policy development, as well as development and assurance that public health needs are met, cultivation of knowledge and behavior conducive to healthy lifestyles for our residents, a focus on resources toward prevention and early intervention, leadership and collaboration with other agencies throughout the county and the region, and the overall goal of public health, which is to have healthy people in healthy communities. Next slide, Stella. Some of the key words that guide the everyday work that we do are innovation and continuous improvement, population health and multiple determinants of health, social justice and diversity, collaboration, quality of care and services, community, partnerships, and evidence-based work. Next slide. This is the Iowa Department of Public Health model, and their mission is to promote and protect the health of Iowans, which is similar to ours, just ours is on a local level. And they have 6 categories that frame the work that we do on our local level. Next slide, Stella. The first of those 6 is the prevention of future epidemics and spread of disease. Here at Dubuque County, this is achieved by receiving and responding to our local health alerts, subcontracting services to the Visiting Nurse Association like COVID vaccinations and contact tracing efforts, water testing, which has been significantly increased in the past year with the help of our environmental specialist, Bailey, and our healthy living grants like the Healthy Homes and Childhood Lead Poisoning, as well as community partnerships for tobacco use prevention and control. The second is promoting healthy behaviors, and this is again achieved through our VNA services and our local public health services grant. as well as our Care for Yourself and Wise Woman grants, and the work of our Dubuque County Food Policy Council and managing those grantees, which is newer to the Board of Health this year. Next slide. The third category is preventing injury. This is achieved through our Community Health Needs Assessment and Improvement Plan, as well as our Wellness Coalition. And protect against environmental hazards, which is again achieved through water testing, as well as septic inspections, well inspections, septic pumper trunk inspections, and again, our lead grant, as well as the tobacco grant, which is new this year. Next slide. The fifth is strengthening public health infrastructure, again, achieved through our China HIP, which is delayed this year. It is due fall of 2023, and that is delayed because of the COVID pandemic. And then also our immunizations, which is subcontracted to the VNA. And lastly, it is to prepare for, respond to, and recover from public health emergencies. This is achieved on the local level through our preparedness grant that we share with the region, local exercises and drills that we do along with EMA, dealing with a live pandemic right now as we work on COVID-19, and collaboration through our incident management team, as well as our joint information committee and the other partners that we have continued to work with over the past 2 years in the healthcare field. We touched a little bit on this, but our current areas of focus are the COVID-19 pandemic, continued response, and vaccination efforts. Additionally, we're focused on environmental health and making sure that Dubuque County residents are safe where they live, work, and play. And then we've got some other public health needs in the community that we also focus on, including support to our local capacity for assessment, planning, and insurance that our basic standards of service delivery are met, and increasing the capacity of our local Board of Health to safeguard the health and wellness of communities by providing leadership and engaging with community stakeholders that support health promotion and preventative services, and ensuring that our local health agencies are prepared to respond during public health emergencies and natural disasters until additional help arrives. Next slide. And Tom Beshin will go over the grants portion of this presentation.
Thank you, Samantha. I'll talk about grants because grants make up a big part of our budget. And grants come to us through the Iowa Department of Public Health. We look to the supervisors to supplement those grants in terms of salary to our staff, you know, the other things that keep the office running. But our grants to county, the grant amount that we're looking at this year is $40,400, which is the same as last year. This, as was reported here in the last couple months, is well on its way to being spent during this fiscal year. We hadn't been so fortunate in previous years, but we are on track to utilize all of those monies from the Iowa Department of Public Health. Healthy homes and childhood lead poisoning prevention. This is the same amount that was designated last year. It's subcontracted to the City of Dubuque Health Department, and basically it's they work on mitigating lead throughout the community. Next slide. Care for Yourself, the Wise Women. This is subcontracted to the VNA. This amount is the same as last year, as is the immunization. I would add that the bottom one here, the Community Partnership for Tobacco Use and Prevention Control, is a new grant this fiscal year to the tune of $50,602. That is, the VNA is already working on these tobacco cessation or smoking cessation. Okay, next slide. Okay, public health grants, local public health services. this is what the biggest part of what the VNA does to support public health in Dubuque County. 204,000 was the amount designated last year, and as far as we know, this will be the same amount this coming year. We don't really know until grants are awarded, and that doesn't normally happen until March or April, so we can only use what we know at this point. This assures public health, nursing and home care for certain people in Dubuque County. Next slide. The 6-year Public Health Emergency Preparedness Grant. This is a large grant, $389,673. This is maybe overstated slightly because this is a 3-year amount, but there are provisions to spend the entire amount in fiscal 2023. So we've included it in this budget. Last year we had about 158,000 in this grant. So this is a big increase, and we expect to be, if we don't get it spent in the 2023, it will carry over through 24 and 25. Public health emergency preparedness. This 20,000 is to assure the Eastern Iowa region. It's centered out of Service Area 6, centered out of Buchanan, but this amount is shared with the counties here in Eastern Iowa. Next slides. Okay, I guess that was everything on the grants. I'll have another piece a little bit farther, and we'll talk about outside the grants. So, Samantha?
Sorry, I was muted. Thank you, Tom. This next slide just touches on some of the upcoming projects we have in the health department. And of course, the first one is our continued COVID-19 vaccination and pandemic response. Our China HIP, which, like I mentioned earlier, is delayed until the fall of 2023, but we will begin working on that here in the coming months. We'll also be maintaining and overseeing all of the grants for FY23. And as Tom just mentioned, most of those are subcontracted through the Visiting Nurse Association, but in the short time that I've been here, I've really seen how needed and impactful their services are to the Dubuque County area. As for environmental health, we'll continue to increase our education for our environmental specialist to ensure that she's aware of the Iowa State codes and regulations that will assist her in her work with well water inspections and septic inspections. And then stay up to date on our lab certifications. This past year, we did have a lab audit that we passed. So we will continue to maintain that status and even potentially certify our newest office clerk in the lab as well, so that she can assist with the water testing. And then as for our preparedness activities, we'll continue to develop the county's preparedness plan and work with key individuals such as Tom Berger from EMA to update our NIMS classes for the designated county employees that we have who will be assisting in disasters, and continue with our countywide coalition that will bring public health individuals to the table to discuss preparedness. And that would include EMA, EMS, hospitals, long-term care facilities, etc. And lastly, we will maintain and provide all state initiatives that are directed through the health office, like those health alerts, our influenza monitoring, COVID monitoring, and things like that. Some recent impacts on the health department. Obviously, with the retirement of our executive director, we are short one staff member. So the Board of Health is now charged with replacing that director, as well as looking at our strategic plan and potentially reorganizing our department. And that, again, comes along with hiring and training additional staff. The China HIP and getting ready to work on that in the coming months so that it is ready by fall 2023. and the lack of department staff to address community needs has been one of our biggest impacts during the COVID-19 pandemic. Some additional concerns that our department will address in the coming years, mostly through our China HIP, include but aren't limited to health inequalities among our vulnerable populations, such as people of color, the LGBTQ+ community, and older adults. And we will also focus more on mental health impacts in Dubuque County, especially following the COVID-19 pandemic, as we know that's becoming an increased concern. And the next slide is again on our budget request for this year, so I will pass it back over to Tom Beshin.
Okay. This year we have 200,000 designated for COVID-19 related expenses. Megan has advised that it would be wise to put a placeholder in the amount of $50,000 into the 2023 budget. You know, don't have any specifics at this point, but you know, just in the past couple of weeks, we've approved the purchase of additional masks. So we expect that there will be some COVID-related expenses into 2023. The only other thing I'd say about the budget is that basically for most of the other accounts, with the exception of a few accounts for mailing and supplies, we're moving forward with a budget that reflects the budget that was in place for 2022. So we're not looking at any increased expenses other than the normal 3% that we've allocated to VNA for their expenses that don't get covered under grants. And last year that was nearly $300,000. So that is what we have as far as a presentation related to the budget. Stella has the worksheet. I know there was a line item regarding the ARPA request for departmental reorganization. We're prepared to move into that if there are, unless you have other questions at this point.
I do not. So thank you for that presentation so far.
I have nothing, Ann.
I just have a comment, which is just a clarification. The lead grant that Samantha was talking about is for the city of Dubuque. There is also a lead grant that we received for the county, but that is administered by ECIA.
Okay, maybe I misspoke. Maybe it was ECIA, the $8,808 rather than the city of Dubuque.
No, there's always two, Tom. There is one that we facilitate. We are the holder of the lead grant historically that goes to the city of Dubuque. That's how that grant has to fund. And then there was another one that ECIA, the only one that's ever happened for outside the city of Dubuque for ECIA. So you're correct.
Okay.
It's just I just didn't want. I think probably mostly for the edification of Supervisor Potoff that there are two lead grants that are administered by two different groups.
Okay. Thank you, Ann, for the clarification.
Thank you, Ann.
Okay. If there are no other questions, we could move forward to the next slide, Stella.
Okay, so like Tom said, one last thing we wanted to touch on during our presentation is the ARPA proposal that you do have in front of you. And this was presented to you back in late summer or early fall of this past year. And a lot has changed for our department since then. But ultimately what the proposal is getting at is that we are a small department that would benefit significantly from increased staff. The proposal for restructuring the health department is based on the 5 social determinants of public health, which include economic resources, lifestyle, built environment, healthcare, and education. And the project goals are to increase the scope of services provided directly by the Dubuque County Health Department, increase awareness of those available services throughout the community, increase our community collaboration in terms of public health services, and increase the reach of Dubuque County Health Department to its county residents. Next slide. So right now, with our office at full capacity, we have 3.5 employees: the executive director, the assistant director, the environmental specialist, and our office clerk, who is part-time. This proposal would keep those 3 full-time positions. It would also bump our part-time clerk up to full-time, and then it would add 3 additional positions. That includes the lifestyle specialist, which would focus on China hip activities, lifestyle changes, nutrition, healthy habits, and be a point of contact for the Food Policy Council. The healthcare oversight or healthcare service oversight specialist would be full-time as well. And really what that position would do is continue the positive relationships we've developed with healthcare providers in the county throughout the COVID-19 pandemic. They would also work on a closer level with the Visiting Nurse Association, who would continue to subcontract those nursing services. And then the last position would be a community education and outreach specialist. And this person would be responsible for educating the public on our public health activities or public health messages that are important at the time. And this would more specifically be involved with our schools, because again, that was another relationship that was developed even stronger throughout the COVID pandemic. And this would maintain that relationship that we now have. Specifically, the lifestyle specialist and the community education and outreach specialist are positions that we felt were not being addressed currently by the VNA or the Dubuque County Health Department. And so that's where their roles and responsibilities were developed. Next slide. The Board of Health members met with Scott, Lynn, Johnson, and Blackhawk County to ask some questions about their staffing numbers, revenue, expenditures, and contribution from the county, just to compare them to what Dubuque County does. And you can see those numbers right here on the board. Johnson County, where it has a question mark, is 50. That should say 50 staff. Sorry about that. And one other note to this slide is that the VNA has 8.13 full-time employees. So with that added to Dubuque County's 3.5, it's just under 12. So it is still significantly smaller than other counties in our region, though we know those counties are bigger than Dubuque. But I do have our board chair, Sandra Larson, here, who would like to speak on the ARPA proposal as well, if that's all right.
Here it is.
Yes, that's fine, Sandra.
Thank you.
Welcome.
Thank you. It's nice to see you in person. I'm Sandra Larson, and I'm recently, just last week, was elected to be the chairperson of the Board of Health. And I'm so happy that you've given me a few minutes today to speak to our ARPA proposal. 272, 8,317, 871,000, $16 trillion. What are those numbers? Sadly, 272 Dubuque County residents died of COVID. 8,317 people died in Iowa. 871,000 people have died in the United States. And the projected economic damage was $16 trillion. Dubuque County can do better than this. We can be better prepared next time by creating a healthier county and being better prepared. The community assessment.
Sambo.
The community assessment that Samantha spoke about shows that we do have needs and deficiencies here in the county as it applies to health. They include equity in the access to healthcare, brain health needs, chronic illnesses related to lifestyle and food, and misinformation. The health department developed this ARPA proposal to address some of those unmet needs that were identified during the China HIP, but also identified and exacerbated during the pandemic. The Board of Health who you appointed to protect the health of the county, approved the proposal in September unanimously. We are 100% behind it. And what is the proposal? Currently, we have 3.5 full-time equivalents in the health department. We want to be able to increase the department's ability to impact the county, about the county's health. And we would do that by increasing our FTEs to 7. So that's doubling it. That sounds like a lot, doesn't it? It's not when you compare us to other counties. Let me just talk about Johnson County as compared to Dubuque County for just a minute. They have about 156,000 population. We have 96,000 population. They have 50 employees. We have 3.5. If you just use the percentages, we should have about 30 employees. And then this was interesting, and I'm not saying this is involved with our health department or anything else, but it's an interesting statistic. 120 people died of COVID in Johnson County. 232 people died in our county. Now, I don't know why. There's lots of different inputs and impacts that cause that, but it's an interesting statistic. So our proposal is our 3 full-time equivalent staff that will remain unchanged. We would very much need to increase the office clerk to full-time. She's currently 0.7. She needs to be full-time. It may be the only department in the county that doesn't have a full-time office clerk. So we would really find that to be an integral part of this plan. Part of our plan, there's an Appendix B that explains all the different, 3 new employees that we would like to hire, and it goes into them very specifically. I'm going to just mention the first one, or the last one that's listed in our appendix, but one that is probably the most important, and that is educator, communicator. And when I interviewed Patrice Lambert as she was retiring, she said that was the most important person to be added to our health department, and that is an educator and communicator. So the goals are increase services, increase awareness, increase collaboration, improve the health of the county. A healthy community is good for your voters. It's good for business. A healthy community is an economically prosperous community, and it's doable. We can make an impact. So on behalf of the department and the board, we respectfully request that when it comes to time to look at the ARPA requests, that you adopt the ARPA proposal for the health department. I appreciate your time. Thank you.
Thank you, Sandra.
Thank you.
Do you have any questions or anything, Jay or Ian?
Well, I would make a comment that this has been a tremendous presentation, and I am, I really thank Sandra, Tom, and Samantha for speaking forcefully and staying direct to the point. And I hear the challenge that you've all given us, which is to find a way to make the department better and stronger and more relevant to the entire county. And I think the ARPA funding is an easy answer, but even without that, I would propose that we find a way in an ongoing budget to make this happen. So I value very much the work that all 3 of you have done throughout the pandemic that goes on. But thank you all for your contribution today. It's remarkable, and I've listened, and I think I've heard. So thank you.
Thank you, Supervisor McDonough.
Do you have anything, Jay?
No questions, but I do generally support the proposal that's in front of us, and appreciate you taking the time to prepare that.
Thank you.
I would, in general, support it. I don't know that it really falls into the ARP because it's supposed to be a one-time thing. You're adding 3 employees. That's not a one-time cost.
Right.
So eventually the county's gonna have to pick it up where you get grants. Or if the grants run out and we don't pick it up, we have employees that are hanging in limbo,
Right.
which obviously causes concern for people. I understand the need for more people. There's no doubt about that. But how to fund it, I think we can work around and hopefully come up with something between myself and my colleagues.
Thank you. I appreciate it. The only other thing that we had thought about with this proposal is, applying for external grants for those staff members. But with the current staffing situation, there really is no time for us to even be seeking out grants. And so that's why starting us off with some additional staff, whether it be 3 or 1 or 2, would greatly help us in our capacity to address public health needs, but also spend some time looking at those grants and increasing our services in general.
Okay.
Thank you.
Samantha, it's Ann again. I just have a question for you, but where would you put all these folks? Have you done any, we put the environmental specialist in I think it was a filing room that we retrofitted in our new building for the environmental specialist. How would you do that? Just curious.
Yeah, we have rearranged things a little bit at the health department right now. There's actually 2 in what was the assistant director's room. So now the environmental specialist and the assistant director share space. And the space where the executive director was could potentially house 2 people as well. And then we have that filing cabinet room still available. So there is room, but I think if we moved forward with more staffing, that would be a separate conversation to have too.
I didn't doubt that you'd given it some thought. Thank you, Samantha.
Okay, thank you all.
Thank
Thank
you.
you. Thank you.
Thanks, Tom.
Thank you, Samantha. Congratulations on your appointment as chair. Thank you, Tom, for your years on as a chair.
Thank you, Harley.
Stella, can I ask you a question directly relates to their ARPA request?
Sure.
That was the Supervisor Potoff talked about how we would fund this. And do you have any thoughts about that? I mean, how might we do this?
Sure. So ARPA funding would qualify. This would qualify for ARPA funding. The issue becomes, how do you fund this on an ongoing basis? So staff obviously is a ongoing expense to us. The health department, Board of Health employees operate out of our general basic fund. So what you would be doing is, if you decided to use ARPA funding, maybe for a year or 2 of this, then also agreeing to allocate this funding into general basic on an ongoing go forward basis.
So it's not disqualified by the federal regs. Obviously, it's even a major part of what they're encouraging us to do.
Sure. They did, specify that capital items do work really well within this guidance, and less ongoing programmatic expenses. So there is that consideration of how do you continue to fund a request like this into perpetuity.
So in their budget sheet that they included, I don't know if you have that at hand, when they looked at the costs that they would need, the annual budget costs, and then I'm not sure what proposed grant costs are. Do you have that by chance?
Let me just pull up.
It looks like it's the annual budget improvement of $300,000.
Yes. Let me share that too, so everybody can see what we're talking about.
So that could be their share of ARPA funding to get this out the gate, obviously recognizing Supervisor Potoff, what you mentioned, which is, you make a commitment to an employee unless we say, I don't even know if the union contracts allow that, but if you say it's a contract or something, but, you know, there's the cost for the annual budget increase to certainly make significant changes to staffing that I think I heard us all say we thought were important. I mean, I would be, again, I mean, I support this completely, that it come from ARPA funds seems important. It gets us out of the gate with the first year, maybe it's 2 years. It's, I don't know what my colleagues' thoughts are about that. I mean, it does talk, our agenda does say that there's possible action on these budget requests. So I just raised that in that context that, is this accurate, do you think, Stella, in terms of costs, and do they properly have benefits and everything? Did you help them with this by chance?
I did not. I don't know, maybe John helped with some costs.
Yep, this is Dawn in the boardroom. There'll be slight changes to insurance. And that should be about it. IPER stays the same for next year. So there'll just be that, that 7% increase or 5% increase to health insurance would be the only difference.
Right. And if we really thought this was important to begin early, we could amend our fiscal 22 year budget. We have that kind of funding. I mean, ARPA could be used to amend fiscal year 22 to start adding in some of these costs as well, right?
Absolutely.
So I think some of this is really up to the, you know, the wish of the board, if we can form consensus about, is this high need, and, you know, what is the timing on this? I'm certainly prepared to go forward.
I'm generally comfortable moving forward, and if we're looking at American Rescue Funds, health preparedness is probably one of the key areas.
Sorry, Jay.
No worries.
If you could repeat what you said.
I think I generally support it, and specifically if we're using American Rescue Funds, one of the leading, areas was obviously health. Was one of the stronger proponents for the funding allocations.
Like I said, I'm generally in support of it. I was just curious on the ARP fund because it's an ongoing expense, how it was going to be funded after that. That was my question.
A disadvantage that I have, and I understand it's of my own making, is not being present. I don't know if Samantha is still with us. I know Bailey is on Zoom. Tom Beshan, at least, is he's in the Hollywood Square box. If Sandra is still present, if there's a way for, I think there's consensus on this, but I also think this has to be incorporated back to the Board of Health for maybe something more specific, or how does this fit with your search for the executive director, and the timing of your staff of onboarding new people and doing that search? I'm not trying to give you a problem, but I am thinking this might be helpful to hear our budget thoughts about fiscal year 22 to be amended and beginning in July with these numbers as well, a more robust budget. Do you have questions for us?
Are we on?
Yeah.
Well, I think that the sooner the better, as far as staff goes. And I do think that we're meeting tomorrow with Human Resources, and I think the executive director will be the first hire. That would be my thought. And then we would go forward from there. But we need the clerk, the office clerk, and if we could get started earlier than July, that would be great on these new staff members. What do you think?
No, I agree with Sandra in that sooner is better, especially while we're still. Can you hear me, Ann? Sorry.
Yeah, no, I think we need, let's get let's fix a 0.3 position in clerical. Can't we fix that today? I would make a motion that we amend that position to include full-time position with the clerk. And that be part of a fiscal year 22 amended budget.
I'll second that.
What?
Have a motion and a second to move the part-time clerk to a full-time position to help out at the Board of Health. Any discussion, any further discussion needed?
And that was for an amendment for this current fiscal year, which would basically give you the green light to start hiring immediately for that. Is that your motion, Supervisor McDonough? Did I summarize that?
Yes, that is correct.
Yeah, we have a motion and a second. All in favor signify by aye.
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 Aye. Motion carries.
Thank you. Thank you.
This is Stella. I think the way forward kind of on some of these ARPA applications is with consensus to move forward and then further defining exactly the costs. So the health department did put this together a while ago, and we believe these costs to be pretty still accurate. But I think what we would do with consensus of the board is come back with kind of the final numbers for action.
Yeah. And I think I'd like to have you include this too in, because it comes from general basic, which is capped. That's not something we can easily make more funding in that category. So to look at what that looks like, projecting maybe to year 3 or 4 to see what that does with general basic, that might help Supervisor Potoff too. Those are questions I have. What does this look like a little bit longer term, and to bring on these new employees, just to get a better idea what that budget looks like. And I don't know if we're looking at an increase in the director's pay in the time of the great resignation that we live in. As I said to Patrice, it's unfortunate to Patrice Lambert that, her replacement is quite likely to make more, have more income and be higher compensated than she was after her many years of service.
I think I would be looking at probably adding an employee a year over 2 years or 3 years, something to that effect, instead of all at once. Well, you'd have a couple of years maybe of ARP funding, but we're gonna have to, either we get grants or we're gonna have to pick it up, but we need to, excuse me, we need to know where that money is gonna come from.
I'm personally willing to take a more aggressive position on this, Harley, but I do think it should go back to the budget director to work up, and then also work directly with the Board of Health so they know what the limitations are. But also I want the work that they're doing from our citizens and our volunteers to know that it's going to result in change, and maybe 1 employee a year isn't quite enough. Some of this will be at the direction of the new director. So we're at, there's a lot of things right now in motion, I guess, in their health department. Good discussion though.
Yeah, I think we have consensus for you to kind of work that up then, Stella, correct?
With the Board of Health, yeah, and there was a, direct action related to the clerk as well. So
Right.
there's some new news for the health
Thank
department.
you.
Yeah, thank you all so much. This helps a ton.
Thank you, Samantha. Thanks, Sandra. Exactly.
Okay. Go ahead, Harley. Were you going to say something?
Pardon? He was just saying hi to Zach.
Oh, sorry.
But,
Okay.
you're up.
Yeah, so next up on our agenda, we have our watershed group to,
Make a motion to recess for 5 minutes. I believe Eric is not, he was here, but now he's not. Motion to recess for 5 minutes.
Second.
Have a motion and a second to recess for 5 minutes. All in favor signify by aye.
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 we've been having more fun. We've been having more fun than this.
The board microphone is still live, just FYI.
Yeah, usually. Get it going and then.
I go with my hand so you could hear everybody talking. They're all hot. Oh.
and come down, that'd be wonderful. Not critical, but helpful. Look at that picture.
Isn't
Take
that
one?
nice?
Okay, I've called the Board of
Looks like the
Supervisors
river.
back into session. We will, is Stella with us?
I am here.
There she is. We have Eric and Zach here for the water shed department.
Good afternoon.
Good afternoon, Eric.
I don't have a lot of slides today, but a few, and I thought I would just kind of start with an overview as we head into year 3 of the 2080 watershed agreement, and I guess it would be year 2 of our land stewardship fund. I think since we started this process, I think 18 months ago, as we looked through the restructure of the 2080 agreement and building the watershed team and a watershed staff, developing new programs, really, you know, as we head into year 3 here this June, it feels like so much of it's so fresh yet as things kind of have launched. But this past year, we hired the team. Zach is here with me. John Wiley, our urban conservationist, was hired. The three projects that we have, the Trutera project, the Soil and Water Outcome Fund, and the Ecosystem Services Fund we're all launched, and we're all very successful. I think in the first year, you know, we've used up our fiscal year $21. We're into $22 right now on all 3 programs right now, and we have a few months left of that. But we had 2 really successful farmer field days this past year with over 100 attending each one. Obviously, the website got launched, logo, Facebook, social media, billboards, and so forth. And then lastly, kind of probably the freshest of the programs is the WFPO, the $600,000 NRCS grant that we had a public informational kind of kickoff meeting last Wednesday over in Asbury. So I think it was a really good year this past year. A lot of action, and I think it was a success that all the programs now are moving. We're working with farmers. We're using dollars, I think, you know, in a cost-effective manner and looking at change on the landscape. Ultimately, that's the goal. Like I said, we're entering into year 3 of the 2080 agreement. The county's commitment to that is $238,000, really for the administrative side, minus $30,000 in the healthcare coverage. That covers my health insurance for the family, and then Zach as well too. John is covered under City of Dubuque insurance. So we take off that $30,000, so it comes to, you know, just a little over $200,000 request from Dubuque County. The land stewardship fund in the past has been set at $390,000 for the programs I had just mentioned. This year, my request is $465,000, an increase of $75,000 for the new buffer initiative that was discussed shortly before Christmas time. We had a really good meeting with Stella a few weeks ago. Both myself and Ed Raber sat down and kind of discussed things more in-depthly with Stella, and I think I believe she gave you a printout of land stewardship funding and kind of where we're sitting with those programs right now as we go into 2022, and then kind of gear up and look at changes and what can take place coming up in fiscal year 23. I wanted to review the Trutera Insight Engine. Obviously, we're heading into year 2. Year 1 was somewhat of a pilot, kind of a pilot year, demo year to see how this would work. $92,000 have gone out to farmers in farmer payments. 26 growers were enrolled in the program, and then $7,500 went to the Trutera team for helping administer the program and help get the program kind of up and running and so forth. And I know the supervisors did approve the newest contract with Trutera this past Monday. So it changes as we get into our second year. Obviously, one of the big questions is we had 26 growers in the program this year. How do we continue to work with those growers, first of all, and not lose them after we've just invested time and energy and dollars into their fields and practices? How do we keep them in the program and keep them going with practice changes. But also at the same time, allow dollars open for new growers and new landowners to participate in it. Right now, the intention, Zach and I have been talking about this. We met with ISA team, Innovative Ag team, as well as the Chutera team to kind of talk about, how do we balance this out as far as dollars? The way the Chutera programs work is farmers had made practice changes on their fields, going from, tillage to no-till or strip till, or, planting cover crops in the fall. They received point increases on the insight score. However, as we look at those fields, if they're willing to do the same thing, they're not going to get the point increases. Therefore, what kind of payment would they be receiving from Dubuque County to keep them ingrained in the contract? So what we've come up with right now, what we're proposing is to do a point reduction for all growers that were in the program that want to remain in the program, specifically no-till contracts and cover crop fields. They would be eligible for payment at a reduced cost of $1.50 point increase. So let's just say they went up from a 70 to an 80, and in 2022 they would stay at 80 out of 100. Let's say on the Insight engine, the payment then would be reduced from 250 cents an acre to $1.50 an acre. So you're looking at about a 40% reduction, allowing some dollars now to be used for new growers to be enrolled into the program and to meet with Zach and develop more relationships. But at the same time, if these landowners are willing to stick with, obviously the stress of these programs is to have these farmers stick with the process of these practice changes. It still leaves money in there for them to do so. So I'll stop there and see if anyone has any questions on kind of what we're proposing for the Chutera platform. The other big change, I guess, I don't know if it's big, but as Zach has met with growers and feedback that we've gotten from him and the ISA team is, could we develop a separate contract with the Minnesota Valley testing, essentially between Dubuque County and the nitrate sock sampling testing with growers to help pay for that, to showcase nitrogen reduction in their fields? Can we develop a separate contract with the county, put it into the Chutera program, but at the same time not pay farmers for the kind of payments that they were getting for the stocks nitrate sampling? We felt was too high for us to continue with those payments. So we're reducing those. We're basically saying we'll pay for that, but Zach is gonna help administer the tests themselves, and then have a contract developed with the county to help pay for the nitrate stock sampling. That again would be a change for 2022. Again, this is as we head into a second year of a program, these are some of the things that we're trying to be more cost efficient, more cost effective with local tax dollars, but at the same time keep farmers and growers and renters, excited about changes and keep them going with these programs and kind of help them through this process. And we knew that it is a process and it takes time.
So the 26 growers that were in it last year. The 26 growers that you had last year, how many of those are re-enrolling? Do you know that yet, or?
Right now, we think it's around 15.
Take this too if you want.
Just like,
Yeah, take it.
yeah,
Take it.
I mean, by talking to them,
And if, I don't know, shoot to text message,
what would be
Sorry,
a
on
grade?
Zoom, people are talking over each other. I'm hearing conversation from around the room, from up at the.
Yeah,
Board
we're
of
just about
Super-
done. Do you need this or not?
It's computer issues, and sorry.
Okay, well, I mean, I just can't tell who's saying what, and it's all inaudible.
All right, sorry about that. What was the average raise in points on the Tutera?
I think it was 16 about. I think the average payment was around 3,600 roughly.
Ann or Jay have anything or?
Well, what does the 16 points mean? I guess I need to have some context for that.
So the way the Insight engine works, and if you remember the kind of the whole sustainability matrix that the Insight engine does, if a landowner is going, I think the majority of the growers that are looking at and that we kind of talked about, feedback that we got from Dylan and Mark from Innovative Ag was, the cover crops, the no-till contracts, farmers that have gone from tillage to no-till or reduced tillage are interested in keeping those practices going into year 2. And the feedback that we've got was a $1.50 per point increase, reduced amount from 2021 to 22. They felt good that they would still be enrolled in the program. So when we talk about point increases, the highest point increases were from the reduced tillage and cover crop fields.
And are we keeping, do we have some kind of calculations that, I know we just completed our first year, but do we have an eye in terms of creating the data that shows that we think this is impactful and that, so, we're done with year one. And I know Truterra has a lot of data, but are we keeping it in, Eric, are you keeping the data that shows this is having impact? Because that's what we want to be able to, is to measure, right? We want to be able to show that a change is happening, and then year over year, which obviously is the future, that it's continuing.
Absolutely. The three things that we continue to track and that we have spreadsheets and are tracking are the nitrogen reduction, the phosphorus reduction, and then our greenhouse gases or how it relates to climate and so forth. So those are the three things that we continue to track. The Stormwater Outcome Fund does the same thing. We're running the same model. Zach is using the nutrient tracking tool, which shows the reduction in nutrients over time. As the way we think about it is every one of these growers develops a portfolio with us, and over time we're showcasing how much nitrogen, phosphorus reductions, and then they're comparing that obviously to their yields and so forth at the end of the year. So we're 1 year into it and feel good about going into it with 2022, not losing the 21 growers that were involved, but at the same time allowing money for new growers to get involved too.
On mute.
I think you're on mute.
Thank you. I'm sorry that happened. Just talking generally, Farm Bureau is reporting, and certainly many, many more articles and headlines about the increased use of cover crops. I think generally that's a trend, but do our growers typically, do you know, Zach, if they apply for the $5 per acre, there's a discount on their crop insurance? I mean, is that, you're nodding your head, I see. So I just, as I'm learning, obviously, then I see the interconnectedness of all of this, but it's good to see that though I think we're leading on this, we're part of the change in conversation that's happening with growers, and it appears to be led by growers.
Mm-hmm.
Good.
Good. Continue.
So the Stormwater Outcome Fund, obviously, this was a slide that I stole from Adam Keel, who presented at the September 2080 joint meeting that we had out at the Swiss Valley Nature Center. He had, with the help of Zach and Joe, their conservation agronomist, they have done a lot of field verification this past fall, looking at exactly what took place. There are the fields, 13 executed contracts with farmers. I felt like this was another very successful program, each of them different in their own ways. And the feedback that we got from farmers were probably some positive and negatives on both, depending on which platform we could plug them into. As all three of you know, the basis for both of our programs begins with soil health, and then we kind of go from there to see what we can do for increasing conservation. But right now, we don't have a lot of suggested changes. As you know, the outcome fund is a little bit more hands-off of Dubuque County being involved in a statewide and really a Midwest-driven program now. Multiple states are investing, along with your larger corporations that are investing into these fields as well too. I do have a lot of trust with Adam and Joe, and I feel like we have a good relationship with them. I feel like the metrics that they're taking in the Soil and Water Outcome Fund are appropriate and are on par. I don't feel like it's a program that's driven by big ag or the corporations that are being heavily influenced in these programs. I've known Adam for a long time, and I feel confident moving in, continuing a partnership with the Soil and Water Outcome Fund in Dubuque County right now. And that would be my suggestion as we move forward with continuing farmer contracts right now with the Outcome Fund and Truterra. The Ecosystem Services Fund, we have come very close to spending the entire $140,000 from fiscal year 21. These projects are just a little bit slower, mainly because of things that we've discussed this past year. Obviously, the process that's involved of survey and design of structures and meeting with farmers, and the communication with NRCS and with the district technicians, state technicians. Just keeping that workflow going. Like I've said in the past, we meet every single Monday with NRCS and IDOL staff to talk about projects, to talk about where, things that are in the works, what's getting funded federally, what's getting funded through the state, and then what would be a good candidate for a Dubuque County Ecosystem Services project. So I know the Hoffman structure is ready to go. They have a contractor lined up. And as soon as weather allows, I know they'll be moving dirt for that structure this spring. But I know that obviously the Shields and the Mosina structures have been approved and payments been made, and those documents have all been recorded with Dubuque County. We do have a number of different potential projects in the works. I was just talking with one of the technicians today about when we can start getting out for survey and design. The state is doing interviews right now for a state technician, like we talked about, I think, at the last time. So we will have another technician in the NRCS office helping with some of our projects as well, too. So the fiscal year 23 request remains the same at $140,000 for our ecosystem services. The newest addition that I've talked about roughly a month ago now is the idea of developing a buffer initiative. Like I've said, our programs are designed around nutrient reduction, around soil health, sediment capture with our ecosystem services and our basin packages. But now we're looking at our waterways throughout Dubuque County, and how we can better protect the buffer on both sides of our stream. The feedback I've gotten from commissioners has been very positive, and they feel like this is a program that is going to have success. Zach and I have prioritized the watersheds, as you guys remember, through the buffer initiative proposal. That's all been done. And we have landowner letters and flyers that are in draft mode right now, ready to start sending out to landowners. We didn't have an approved so-called budget or resolution for the buffer initiative from our December 20th meeting here. So that was what I was hopeful to get out of today, that we could proceed with this and that we can proceed with getting the word out. We've had a few landowners stop in the FSA NRCS office and inquire about the buffer program. And then FSA has kind of said, well, until we have a definite word and budgets have been set, we're not saying anything, but things are pretty much ready to go on our end to launch the new buffer initiative. So I'll stop there and see if there's any questions on that.
Can you comment a little bit about how this local program coincides with the federal program?
Yeah, so the way the federal program works, obviously the two federal CRP programs that we're looking at combining forces with or partnering with would be the filter strips, which are native grasses along streams. And then the prairie strips, which are essentially contoured buffer strips in fields that are planted with native grasses too. So both of these programs would require the use of native grasses. They're both 10-year contracts that landowners would sign with the local FSA office. They would receive a annual rental payment for that area of ground that they're looking at renting to the government for either program. That program, that rate really is anywhere between $65 an acre and $200 an acre. It just all depends on soil type and slope and everything. So until we get an application from FSA to say, so-and-so is interested in a CP21 riparian filter strip, we then get a rental rate price back on them. Myself and Zach would then look up the parcel to see if it's in a priority area based on the modeling information that we've had through Houston, which our priorities are based on sediment loads coming to our streams. We then say if it's in a high priority area, they'd be looking at a $200 per acre payment, a one-time payment over a 10-year period. And that payment then would come to the supervisors for approval. Payment would go out then to the landowner. The landowner then we would record a maintenance agreement and contract with Dubuque County, similar to what we do with our ecosystem services. And then they would sign the contract with FSA for their annual rental payments as well too. So that essentially is how the program right now is, how we would envision seeing it working. Obviously, a lot of coordination that needs to take place with FSA and the staff over there. We've been back and forth on some Zoom meetings the last 2 weeks. It seems like a lot of their staff got COVID and then I had COVID. So we were in and out of some meetings, but we are rescheduled up to kind of meet up and figure out how exactly the communication side of it's all going to work. Cause it's just a couple of different moving pieces, but feel like we should be in a pretty good spot here February 1st to roll the program out and aligned, our contracts with theirs and get it moving.
Okay, just to clarify, if I want to put in 50-foot buffer strip, I have 10 acres. Get $200 an acre.
Potentially.
Potentially.
Yep.
So it's $2,000 a year I'm going to get, or do I get one payment of $2,000 per acre?
You would get one payment from Dubuque County for that 10-year period. So you wouldn't get annual payments from Dubuque County. It just would be a upfront 1-year payment. But we're paying for the 10 years all at once.
Right. I'm still getting $200 an acre for 10 years. So I'm getting,
Yes.
I'd get a $20,000 check.
Yes, correct. Yep. And then you'd still get your rental payment. You'd still get your rental from FSA. So the federal government would still say, well, you're still getting your payment. So
basically if it's in CRP.
It is, yep, as long as it's in CRP, yep.
Okay.
This, I think, is a significant change in respect that what we do today would be committing future boards of supervisors, because this is a payment we're committing to for an annual payment over 10 years, as I understood your explanation.
Talk through that. That's a unique point. So that's not exactly how it works, but go ahead, Eric.
Yeah, so it is a unique point. So the way the payment structure would work, even though the contract would be for 10 years, and this is something that as we get into some more of the details with FSA and the contracts with Dubuque County, something that we've got to hammer out is what happens if the property goes for sale or transfers ownership? How does the payment restructure, penalties, fines, all that kind of stuff work? That's something that we have to get worked out in the contract. FSA has a lot of that language already explained and done. I'm not looking at reinventing the wheel on that language. So I think a lot of that language we can take from their federal contract, incorporate it into a Dubuque County contract and have the landowner sign. So they are, if they do want to get out of the buffer payment, there's repayment back to Dubuque County for that.
The concept is the local money, Dubuque County local funds are up first. They're in front,
Yes,
one lump sum.
one lump
And
sum,
the annual payments are from the federal side,
correct.
not our program. So we aren't encumbering future boards. We're doing it up front in this budget year for that lump sum. And then the annual payments are from the federal side.
Yes, correct. I did not explain that well, but yes, it's a one lump sum payment over the 10-year period. So we're not obligating out 10 years on a budget. It's all going to come out of this budget, fiscal year 23. It's their payments from the federal government would come every year. They'd be obligated for a 10-year contract. However, Dubuque County would be obligated for 1 year. Now, if something were to happen, payment would then have to come back to Dubuque County if that buffer is taken out and put back into row crop. And that would bring up another potential. And it happens. It's not real common, but it does happen from time to time.
Realistically, we're not going to be seeking out farmers that already have buffer strips in. We're looking to put people in that don't have it, so they're not going to get a double payment.
No, we would not be looking at grandfathering in existing, as you guys, and something I've talked about in the past at meetings, Dubuque County has done 0 CP21 filter strip buffers in the last 2 years in the county itself. There has not been any. So we don't have to go back and look at, well, there has not been any. In fact, when Ben had talked to me about trying to find a good picture of a buffer strip in Dubuque County, we struggled trying to find a good photo of native grasses along some of our waterways in Dubuque County that are well established. There's some out there.
There's some along the Little Macoka.
Yeah, and there's some out there, but there have not been a lot of farmers that are willing to take land out of production right now and put it into a buffer along the stream. So obviously the whole idea of this program is for them to be more competitive with some of these rental prices.
Okay, so I'm not following. In Harley's hypothetical, you indicated that the county would pay that person $20,000. Yes?
Yeah, so that would be their payment if they sign that contract. They would receive the whole 10 years in one fiscal year. They're getting an upfront payment from the county. So let's say you're saying a 10-year agreement, it's $200 an acre times how many acres?
10 acres.
10 acres he's willing to put in. They would receive one upfront payment of $20,000 from the county over that. It would be good for the 10 years, but it would just be essentially, you're signing a 10-year agreement, you're getting all your money up front.
Correct. So out of our budget, from your request of $75,000, you're not even going to get 4 of Harley's projects, correct?
10 acres
My
is a
project
lot
would
of.
be very large.
That would be.
I understand that. I'm just trying to make sure we're talking about that we're not encumbering future boards because we're paying it all in one fiscal year.
We're not, but the average acre for a stream buffer at 50 feet is not going to be that large, only a few acres, because you have to own a lot of acres to get, the 100 feet along the stream. That if you take 100 feet and divide it by acreage square feet, there's a lot.
Right.
So, I mean, most likely the average implementation might be 2 or 3 acres, 5 acres.
Yeah, I would say, a 2 to 4 acre run would be pretty good with a landowner. That's quite a bit of buffer that we're putting in. Now, if we move the other program, the CP43, which is the prairie buffer strips, and Iowa State has a decade of research on how successful these prairie strips are in fields for nitrogen reduction, sediment reduction, pollinator habitat. There is a lot of research that's been done. We have not had any of those contracts in Dubuque County either. I've had some landowners inquire as we've met and have been sending out our conservation packages and our letters. We've had some inquirers about it. We have not had anyone enrolled. So that one might chew up a little bit more. I think I'm a very big supporter of the prairie strip. The more research that I've done on that, we have to try and determine and how we can figure out, especially with our hills in Dubuque County, how we can get more landowners involved in that.
How big are those strips? Same thing, 50 foot or?
They can be a little bit wider. That is a little bit more of a, we get into a little bit more NRCS design with those strips. So they actually design them based on the drainage coming to them.
All right.
How many projects would you anticipate doing with $75,000? What's your goal?
Well, our goal is 50 acres.
I see that. But is
so-
that how many landowners?
Gosh, it's really hard to gauge. I'm going to say,
Because the per acre may vary, but if you did, you've got to, if you split the middle $150 an acre, and if the average farmer's gonna have 4 acres, that's only, less than $1,000, it's $600 for that piece, so you could do quite a few. It's really finding, if it's 205 acres, then it's higher, so you'd easily be able to have 50. And I think, obviously, we're gonna look for the most impactful.
yep, it's with this being so brand new and the struggle that we've had to get any one of these CP21 or 43 programs off the ground in the last 2 years in Dubuque County, there's been 0. It's hard to say, but the goal is not to have 4 landowners use the 50 acres along their streams. The goal is going to be, and maybe this is something that we need to look at as an application period that starts. I mean, right now it's kind of a first come, first serve. But maybe, if we have a lot of demand, and this is the first year, so I have no idea. I have heard a lot of good, positive feedback from commissioners that they think this is going to be successful, that farmers are going to be supportive of this and that would take advantage of it. Is it 25 different growers? I think would be a good number to shoot for, potentially more. And, down the road, maybe we need to move to a period that, February 1st to May 31st is when you can apply for it. And then we determine how many we can fund, much like you would with an application period. So that's something that we could look at as well too, not knowing, exactly what kind of support we're going to have for it. I'd be hesitant to do that just because I think more so FSA's programs are always changing from year to year. They're always moving. Their dates are always changing. So we need to be aware of that. So just making sure that right now we know these application periods open. We've been given the green light and to use an ecosystem services payment from Dubuque County and kind of encompass the pollinator habitat, the climate, the greenhouse gas and the carbon capture, to look at all the different environmental benefits from buffers in these programs, and to call it an ecosystem payment is kind of the intent behind it.
So
Is there any variation from the 50 foot, like could they go 40 foot or 30 foot, or does it have to be the 50?
We'll follow all of FSA's requirements, but based on research and feedback that we've gotten from commissioners, Minnesota obviously has a buffer, ordinance in place. We felt like 50 foot was the appropriate level to try and get landowners involved in it, to come up with a significant acreage, but also make a meaningful impact and not have, these small little areas along a stream that larger storm events and so forth, they don't serve all that much of a purpose then. So it's just trying to be as cost effective as we can based on the research that's out there on buffers.
And probably the average would be 2 acres or less, because
Yeah, I would think so too.
just rough figure 50 foot, you're talking practically a quarter mile to make an acre
Right,
at 50 foot. So that's a long ways.
right. Yeah,
Nice, but probably not probable.
Right.
Of different landowners.
Right. But I'm just saying to have one landowner have a half-mile stretch. That's a
Yeah.
lot.
I mean, if you remember in our priority watersheds, our goal was to take out roughly right now, based on Houston's data, using the information we have a little over, it was like 1,700 acres that are being cropped right now in the floodplain along our streams. So Right now, 50 acres is a start, but we're trying to look at how can we take out cropped acres in a floodplain and get them into buffers.
Right, and it's gonna help clean up the water if there is a flood. Catch
Yep.
the silt, keep it from going downstream.
A question, who's going to monitor this for compliance? How does that work? We will make an upfront payment, and then it would seem that we're on to our next 10 landowners next year. Who takes care of all this not enforcement, but monitoring?
Yeah, so that's a great question. The way that works is through it would be through Zach. Obviously, Zach does field verification, has done a lot of field verification this past fall with all of our contracts, both the Outcome Fund and Truterra. This program would follow similar suit. It would go under one of his responsibilities, but it would also, we have the assistance of NRCS with that as well too. So NRCS is doing field checks. All these areas would be under an FSA contract, which is the intent of having that partnership with FSA and NRCS, having them involved with this process as well too, because it is a pretty big undertaking to look at not only the establishment period and making sure that we are having successful stands out there, but also the maintenance period as we get into year 3, 4, and 5. And you know, these areas need maintenance as well too. We have the assistance of NRCS with that as well too.
Yeah, I think that's a good point, you know, and so what we've done on these programs is partnered with larger entities. And so Truterra, and in this case, FSA and others. So we're not, you know, out there by ourselves doing all the compliance, all the origination of the contracts, the origination of the programs. We're taking existing programs that we feel and think they work and trying to get more uptake and more participation in our local county.
Yep.
And do you have anything further?
No, I think it's great. Are we looking for a motion to approve this?
Do you need that, Eric? I will make that motion.
Second.
I have a motion and a second to approve the buffer program for 75,000. All in favor signify by aye.
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 The last thing I was going to mention real quick on this, I know earlier today you were talking about the American Rescue dollars and applications, and one of those funding proposals is an application from SILT. Susan had sent a few different emails out as it would somewhat correlate, and I'm supportive of her application to Dubuque County. You know, her buffer initiative and buffer proposal in that program is a little bit different, obviously, than what our program is developed around the ecosystem services, more permanent easement areas, and looking at how SILT can play a much bigger role in Dubuque County. But I'm very supportive of that proposal, and just wanted to mention that quickly as you guys start to look at those. And as Zach, you know, her proposal would be bringing another employee in that would be housed in Dubuque County, that would be a SILT employee, not a district or county employee. But obviously there would be additional coordination efforts with Zach, NRCS staff, and then a potential future SILT employee as well too, as it relates. So I just wanted to mention that really quick in this proposal as you guys look at those applications.
And Eric, that request is for $1.6 million. And I appreciate that you support it. But I probably need more than your support for that. In other words, just more than saying it's a great idea. It's going to come, you know, there's a limited resources. And so, you know, is it scalable down? Does it still make sense if it's smaller? So when we get to the time to hear from her, I think I'd like to have you be a little bit, you know, I'd like to have you be an advocate for us too, to make sense of how that might fit in a budget request.
Yeah, absolutely. I've had some brief conversations with Susan. I talked to her this week actually a little bit, just to give her a heads up on how competitive and how many applications Dubuque County got. I think they're pledging $350,000 locally out of the SILT program that would go into Dubuque County and the efforts that she's making. So there is some significant dollars, I think, from the SILT organization that they would want to be involved with Dubuque County and highlight Dubuque as one of the 3 counties that they're trying to make priority counties in the state of Iowa. And we have kind of briefly talked about what kind of dollar amount, the 1.5 or 6 million seems like it pretty much impossible to try and get those kind of dollars, but skimming that down, what kind of, where's the feedback that you feel comfortable that we could still make this program go with SILT and the collaboration. And so I'm happy to be part of those conversations down the road. The farmer field days, we've got 2, possibly 3 planned for this year. We're looking at partnering with Practical Farmers of Iowa. Marissa and Andrew Waldo, our other private conservation agronomists, have a good relationship with some of their staff and have been discussing the success that we've had with our farmer field days in 21. And I think they're looking at how they could help promote and be a part of our field days moving forward. I think they're great events, obviously, to get farmers talking. We've got our winter roundtable series underway right now. We've got our second one coming up in New Vienna on small grains here in a few weeks. I think it's February 8th. And then again, I'm trying to, one of the goals on my end is to try and get more coordination with our recreational groups in Dubuque to let them know and to try and create more awareness of the work that's taking place on behalf of Dubuque County and the district, with the kayak group and the recreational groups, trout fishermen, any users. We saw these huge increases in our park system in Dubuque County, but we need to make sure that we're collaborating and helping them better understand the efforts that are being made by Dubuque County and our supervisors and our elected officials as it relates to environmental outcomes and resources. The WFPO plan, I have just one quick slide on here. Obviously, we had our input meeting this past week. I thought it went pretty well. I was bummed that I couldn't be there in person, but I had a lot of good feedback from different folks on that too. So I think they're still in this planning stage of identifying project site and landowners. We have a meeting coming up tomorrow to kind of get some more feedback on that. But I wanted to just, I know I'm probably getting low on time here, but I wanted to just real quickly kind of talk about something that I've been kind of working on the last few weeks here. Something that was talked about with this Water Infrastructure Fund, $75 million that was made available to the Iowa Finance Authority, $40 million for economically significant projects, $5 million for watershed projects. And the Little Macocota Greenway project, I think, is something that has been talked about now for the last 2 years. I know it's in the county comprehension plan. I think we looked at submitting a larger federal FEMA application for this area last year and just decided, we didn't have enough information ready to go for it. Something that I'm going to be discussing with the soil and water commissioners at the February meeting will be support for hiring a project consultant and or adding on to the JEO contract to develop a proposal to look at how we could potentially utilize some of these existing dollars that are out there with the Iowa Finance Authority Board for the Little Macocota Greenway project. I feel like the feedback that we've gotten so far from folks in Sageville and others are a project like this is not potentially will not have significant flood reduction impacts to some communities, but I do still feel like it's a very good project. I still think it will help with flood reduction, but I also like the idea of how we can better coordinate with our recreational groups, how we could make this more of a water trail, a kayak canoe destination area, and to get some of the crops taken out of the floodplain in this area as well too. And then again, coordinating this with our WFPO project team. I've had discussion with them this week on this concept and having a proposal developed specifically for WIF funding and the possibilities that exist there. We've had meetings with WIF and the Iowa Finance Authority staff on dollars available. There is project dollars still left. As you guys remember, this is a rolling application. The feedback that I've gotten is a good amount of the 40 million has has been or will be awarded very soon. But there's still some money left. And the other thing that the finance team kind of explained to us is there's a very strong likelihood, and what they want to show is very good support to the governor, that as more dollars come available, there's going to be another round of money coming into the state, that the Iowa Finance Authority could be a part of additional dollars, and that they're going to be looking for shovel-ready projects ready to go. Having a proposal developed and having it ready to roll, I think, is going to be important for the establishment of this project. So something that I have in the district budget potentially is contractually to look at developing dollars with a consultant to put a project application together that's ready to roll as soon as potentially in the next couple of weeks. But at the same time, if we miss out on this first round of funding, can we be ready to go if there's a second round of funding? There's obviously no guarantees there, but I also think, I know a lot of the money is probably going down to metropolitan, the Des Moines, Polk County area, because they had a number of shovel-ready projects ready. But I feel like this Greenway project is something we've talked about now for a while, and I think it's to the point where we can keep moving on this. And the WFPO team felt very supportive of that as well too. So something, I guess, right now just to be aware of, and look at how we can be ready to go with some potential future dollars coming in from this American Rescue dollars, and how the governor reallocates things. There is still some money left in both of the watershed project budget and the economically significant impact projects as well too. So it's just a matter of
I have a question for you. At the meeting, the WFPO meeting in Asbury, there was a comment made that I think we should pause over, which I did not understand, and maybe you can help me understand this better. Any structure or change that we make, the county is responsible forever to maintain, regardless of climate change, regardless of impact. So we make a physical structural change, that's on our dime forever, and not knowing what climate change is going to be. All of the programming and things we've talked about to date have been that the landowner is required to do something. Now we're looking at whether or not the county is liable for maintenance on structures yet to be determined. I think we need to look at some set aside funding. We need to be sure that the county is prepared to take on that. Do I misunderstand something?
No, that's very accurate. And I remember Scott talking about that at the meeting on Wednesday as well too. And I think what's happened in the past, why he was discussing that with the PL 566 program in general, was it was designed typically on very large, expensive, multi-million-dollar projects. And a lot of these were dammed projects, dike projects, and significant projects. And then 20 years into it, they had pipes that had to get replaced, and counties took on costs they didn't have dollars ready for. And it really impacted the PL 566 program. And since then, NRCS has revamped it to the WFPO program now. A Little Maquoketa to Greenway project obviously is looking at floodplain acquisition, would be looking at easements potentially, would be looking at conversion of crop ground to prairie, and then hopefully stream bank stabilization work along with oxbow wetland creation. All of those projects I just mentioned typically have had pretty high success as far as it would relate to maintenance. Yes, there probably would be some maintenance related costs associated with that we'd have to start building in on a multi-million-dollar project like the Greenway project. But I feel like, in generally speaking, I think the caution was for counties when you're looking at these massive multi-million-dollar projects is to start developing a maintenance schedule for these. The Greenway project is fresh enough. It's not developed enough to where we would even know what kind of cost we'd be looking at, anything like that. But again, until we get a proposal moving to get some of the more specifics dialed in on a project like this, we really don't know.
I would definitely support this project. And I think on the document I have, it says $15,000. Yours is still in your question mark, I believe. And so do you have 15 as well?
So I changed that because I had a conversation yesterday with the team and I said, hey, what are your thoughts? We're having a meeting tomorrow or Friday with them again. And I'm saying, let's look at this. Let's revisit this. Can we get a little bit more accurate cost? Are we talking 15,000, 10,000? Are we talking 50,000? I don't feel like it's that going to be that expensive of a project, but again, until I get feedback from them, I just kind of wanted to lay it out here right now in our budget discussion so that you guys know. And I'm going to be discussing with the district commissioners at their February meeting as well.
So are you proposing this for next fiscal year starting in July? Or potentially an amendment for this year?
Right now, I'd be looking at proposing it to the district commissioners for their feedback and looking at leftover dollars that they would have in their budget and funding it through them.
Okay. So it's more informational for us related to our budget.
Yep.
Okay, thank you. I still support it.
I have nothing further, Ann.
I think I'm the one that had the hesitancy on this originally, Eric, about this Little Macokota, because I think we need to know the costs. It's a big project and we've talked about it, yes, for the past year and a half, but we've never had full scope. So I don't disagree with anything you're trying to do, but I'm not probably, I'm supportive of the concept, but I do think it needs to be budgeted conservatively.
Yes, I agree with you. And I that's exactly the details that we need to get at that I think we've talked about for the last year and a half, 2 years. And that's what I'll be discussing about with the commissioners to try and the JEO WFPO team that we have working on this to see what we need to do to try and get this dialed in a little bit more. So it's not just this concept, but it's an actual project that we can take and move forward potentially with some of these, state/federal dollars that have come in. Lastly, just, real quickly, a 28E meeting. It's already that time for our joint meeting coming up. I have been in communication with Professor Adam Hoffman. We'll be getting our 2021 water monitoring results and presentation from him. I'm looking at February 23rd right now. It's kind of a tentative date. Been trying to kind of get feelers back from everyone, but I'm looking at February 23rd to kind of do our annual 28E meeting. If you guys remember, we do 2 of them a year with City of Dubuque and partners involved too. And I have been in communication with the City of Dubuque as well too, to determine what we need to do to get in front of council and also educate and look at how we can inform the new mayor of Dubuque as well, all about the progress and the programs that we're doing in Dubuque as well. So that I probably went over my time allotted of 60 minutes, so I will stop there.
Thank you, Eric. Thank you, Zach.
I don't know if we're looking for consensus as well, but I would generally support the proposal you had. I think your increase, if you jump to the first slide, was from 395 to 4 something.
Yeah, it would be an increase of $75,000 to $460,000.
Which is a new program we just approved. So assuming we want to keep doing everything else is intact, I would support those levels.
The improvement I see is an internship, a part-time internship in your budget request.
Yes, that is something that I'll be discussing at the February meeting with the commissioners as well too. We do have dollars in administratively through the 2080 for an intern. John Wiley, John's not here today, but has spent a lot of the first year, learning the stormwater MS4 ordinance programs and all the regulations that are associated with those, and then the inspection process. But he's also a very talented and smart guy that we want to use him in some different ways as well too, with GIS establishment and other avenues with these programs. And one thing that I think would help would be to have another stormwater / inspector out there, and having an intern through the district, I think would also, there's enough, the workload's definitely there. We've had them in the past. The district has hired interns, part-time employees in the past. We have not in the last 4 to 5 years, just through transitions and restructures. It was more babysitting that was actually worth my time. But I think we're at a point right now where I think that an intern would be pretty good, and we'd like to get that position open and created here in the next month.
So we'd be looking at for approval of the 390,000 for the Tutera and the other programs yet.
Yeah, the approval for it, I think it's for 465,000.
We approved the 75 already.
Agreed.
So
Maybe we can have Stella come back on and from the budget perspective, what other action do we need to take with regard to this? It appears to be generally just year over year. The one motion we made is the $75,000 new program. Is there anything else specific that we should be addressing here?
I do believe that you should approve the 390 if you want to stay at the current level of funding. Eric does operate under the 28E agreement, so that is funded, but the funding of the programs would be what we would want action on.
I will make a motion to approve the programs for $390,000 for the fiscal year 22.
Second.
did you second, Ann?
Yes, I did.
Okay. Have a motion and a second on the floor regarding the $390,000 watershed budget for fiscal year 22. All in favor signify by aye.
23, I made the
Or
mistake.
23,
I
I'm
said
sorry.
23.
23.
I started it, sorry.
All in favor signify by aye.
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 Aye. Motion carries.
Good work, guys. Keep
All right.
it up.
Thank you for
Great
your
job
time.
launching the program and implementing
Thank
it.
you, Zach.
That's challenging.
Thank you.
New stuff. Great work.
Applause from the gallery. Well done.
Thank you.
Okay, next, Stella, Jay has to leave in about 5 minutes, you said, Jay, or?
Roughly, yes. So,
Okay,
Tom Berger's so senior.
so we had still CJ and Tom Berger on the agenda. So
Both of them are here.
how do you want to handle it as a board?
Is it, if it's for reals that Jay's going to leave in 5 minutes, I would let the two of them decide who can present in 5 minutes.
I would say CJ has two
CJ 's
capital
yes.
requests. Yeah.
Okay, we'll have CJ present them. If that's okay with you, Stella?
Yep, he's next up on our agenda.
All righty. Well, good afternoon, everybody.
See you, Zach.
How's everybody doing? It's 3:40 or so here in the afternoon. I guess looks like you're tolerating this well. So my budget, is sort of a kind of a boring budget, frankly. It remains relatively constant. We still have the same amount of employees. It's changed a little bit in the sense that when I started back in 2019, there were 3 part-time support staff. And as you will maybe recall over the years that those folks have retired. In fact, we've had 8 retirements since I started, 3 lawyers and 5 support staff. And those 3 part-timers were replaced ultimately with full-timers. So in the grand scheme, we're about half of a full-time employee up from where we were historically, but it works much better this way with the full-time folks. We just had one of the lawyers retire as of January 7th of this year, so we're looking for a replacement. But other than that, as we kind of move through the budget, the numbers have remained relatively the same, except for the increases, of course, for the wages under their contracts. I have 2 additions to talk about this year. One is that the scanning one, Don? Very good. Thanks, Ann. So we still have old paper files that are of the time period from about the last 10 years. Anything that was been more than 10 years old, as we have constantly just purged those files. So they are kept across the street in the old Kirby building down on the ground floor there. And it's always sort of an interesting excursion to go over there and get something. But this is something that's been on my mind right since I started. We eliminated paper files. That was one of the first things I did. Everything we have is electronic. So anybody can access all of it on their desktop. They can get it on their laptop. Every attorney and employee has a VPN, so they can go home. They can do everything from home that they could do sitting in their office. I advocated for Wi-Fi in the law enforcement center because, as you probably will recall, Supervisor Potoff, that's a pretty tight ship over there. And we couldn't get to our files when we would go over there to do depositions and any other work. So I worked with Nathan, and he worked with, and I'm bad with names, but the gentleman from the city that
Gonzalez.
No, the gentleman from the city of Dubuque that does all of their IT takes care of that over there. And I'm, like I say, I'm horrible with names, but anyway, we got that job done. And actually there's a hard wire and there's Wi-Fi for us there now when we go over there to do our work. So, so a piece here to me, sort of bubbled to the top. I think there was a time when the sheriff was considering building some building and we were going to move those things, those old files for storage purposes. And I just don't see that as a wise expenditure of keep moving these and moving these. So so I worked with, I spoke to Dawn, and I talked to Nathan, I spoke to Tammy, because all of zoning was all scanned in. And so that's how we came up with this number of about $25,000 to do this. What they will do literally then is scan all those old files, and I believe they go onto the H drive, right, Dawn, or somewhere on the system. Wherever we want, and we can access those from at any time, moving forward. And we do get calls. A lot of times it's from other law enforcement agencies that are doing background checks on people for different things. Some of them are prosecutors, some of them are law enforcement, and we literally have to go across the street and find those old files. I mean, they're indexed, but it's obviously a very antiquated system. So to me, this is sort of a one and you're done, that has great, kind of economic value. And then we can, I don't know if we rent any other space over there, but if we don't, then we don't need to be paying the folks who own the Kirby building anymore for that space. So
Once they're scanned, they'd be.
right, we'll get rid of the hard copies. Absolutely. They'll shred all that and then that'll be gone. So, yeah. So
in favor of that.
right. So, so that's that. The other particular item I was having, and I want to make sure you get out of here, Supervisor Wickham, is for the medical examiner's office. By code, that's under my supervision. We have one medical examiner, Dr. McKeon, and then we have 7 medical examiner investigators. So the medical examiner investigators that we have are mostly, well, they are nurses, licensed nurses, mostly BSNs, some are firefighters or paramedics. So the way, so Dr. McKeon, is just paid on a monthly basis, and we're not seeking any change in his wage. And this is really this just applies to the medical examiner investigators. So the way their arrangement works is they have 7 people that are on call and they rotate. So they cover a 24-hour period at a time. And when they're on call, they get paid 10% of their hourly wage. So right now they make $38.10 an hour. So they get $3.81 an hour if they're just on call. If they're called in to do their investigative work, then they get paid $38.10 an hour. In speaking with Gwen Hall Driscoll, trying to find out how far back this goes as far as this amount, her words were as far as back as she could remember. We did some research. I had her look into some other counties, how they do it. Some of them just do it as a flat weekly fee, like $200 for the week. I think it was Lynn County. Some others were more in tune with this hourly rate. And so, not knowing exactly how long this has been set, it's for $38.10 an hour. I just felt like it is time for these folks to be paid a fair wage for what they do. You can probably, well, imagine without using a whole lot of your imagination what they walk into, and Supervisor Potoff, you, I'm sure, made a few calls to that office. So it's a highly important part of the investigative work. If there is a deceased person there, law enforcement doesn't touch the body. That's the medical examiner's job, and they take care of everything. Once they're called in, they would determine obviously the cause of death if a paramedic hasn't already. Typically the body is then, prepared and it's sent to Ankeny to the state medical examiner's office for the autopsy, and then that report comes back. Often when we have homicides, they are involved, and I can tell you in this last year or more now, we have had several of the investigators have had the medical examiner investigators come in to testify to their findings, whether some came to depositions. When we did the retrial of the Belo case, Jim Abbott's came to Clinton and testified in that case for us, did a fine job. So again, it just seems that this is the time that they are entitled to be paid really closer to what their worth is. And that's really the basis for this increase. Mathematically, I think percentage wise, it's right in that 23% amount. I believe the total for the year, given the hours they cover, is about $4,773. Does that sound about right, Don? For the increase for like a year, is that what we kind of figured? Yeah.
Yeah, but I based it off of their 3-year average of their
Right.
on-call, which is at that 10% of their hourly rate, and average 1,600 regular hours average annually. And so that's where we came up with the 29,773.
Right.
An annual increase over what this year's budget is.
Right, which is 25,000. So obviously it's sort of triggered by whether they get called to actually go to an investigation or not, right? I mean, the on-call increase isn't a whole lot, per hour, needless to say, but $1.90. But if they get called in, there would be a little bit of more of an
I can't
increase.
read that. What's the rate you wanted to go to now?
$50 an hour. They're at $38.10 an hour.
$12 an hour raise.
Yes, sir. Yeah, there you go. And again, according to Gwen, it's as far back as she can remember, and I think she's been involved for 15 or more years, I believe. So Harley, you probably have known Gwen.
She's been there
Since
as long as I remember.
Sure.
I hire business consultants on contracts at higher rates than these.
Sure.
And this seems like much more challenging than my clients. So I would fully support the increase and also support your scanning requests as well.
Yeah, thank you. So, but other than that, the budget just sort of has its increases for the contracting, the wage increases. Other than that, it's remained pretty constant. So that's more than 5 minutes, so I apologize. But I'll answer any questions that you may have, or there's something else I can lend to the discussion.
CJ, yeah, I support this as well. These are, I appreciate you coming to us with this and actually, taking steps forward to get things electronically saved. I mean, that's important. And then obviously overlooked raised, positions that need to be changed. Thank you for bringing this forward. I support both.
Very good. Thank you, Supervisor McDonough. All right, I guess if nothing else, I'll step down. Thank you, folks.
Is that consensus good, Stella, or what?
I was going to say, if anybody wants to make a motion at this time, it'll be officially done.
I'll make a motion to approve the increases in the medical examiners to $50 an hour, and also the $25 expenditure for the scanning of the county attorney's records as described.
And I will second that.
25,000. We have a motion and a second on the floor to approve the 25,000 scanning project and the raise for the medical examiner investigators. All in favor signify by aye.
Aye.
Aye. That carries.
Thank you.
Rescheduled, or these two can move forward without me. Your longstanding leadership, I never question. Up to my colleagues, but I've made prior commitments with a few people here at 4.
Yeah, you had said something right away. So, do you want to move forward with his, Ann, or would you prefer to have Jay here at a different time?
I defer to Jay. If Tom's in the room, it's nice to take that, but it matters to me if a supervisor wishes to be present for it, we should reschedule.
I would advise you to move forward. These are all videotaped and not the final answer.
Okay.
Usually are the final answer, but we certainly always meet again.
We do have Tom Berger here for emergency management. We could do his, and if we have questions, I guess we'll have to come back, maybe have him come back when Jay is present, but I think his presentations are generally pretty straightforward, so.
Right.
You got 10 minutes. We're supposed to be done at 4, right?
Okay, we'll go quick.
Don't worry, I'll hang around. I'll stay till the end. I value your input. You're only going to talk about emergency management.
Well, actually, you have Stella got the PowerPoint. So actually, this is the, I guess I'm Tom Berger, the Dubuque County Emergency Management Coordinator. This is actually the Department 75, which kind of encompasses all of the emergency services related agreements and such that the county has. So, and we do have 2 ARPA requests that, you know, I wouldn't expect to act on today anyway. So the just going through, I tried to do the budget by line item on Stella's worksheet that she sent out. First of all, the hazardous materials emergency planning grant, that's an in and out through funds that are allocated from the federal DOT and through the state to emergency management or to our LEPC. So our LEPC meets twice a year, and mainly that covers hazardous materials training for local first responders. Fiscally, revenues and expenses are dependent on the allocation. So this is one of them that if we don't have any revenues or expense, you know, then we don't have any expenses. So we anticipate $1,720 next year in training in order to do our basic hazardous materials operations class, and the 4,500 in planning for our commodity flow study to do another intersection with that tells us the hazardous materials that are going through the area. So next slide. The EMS services, this has been changed in the last couple of years. We used to get the money direct to the supervisors. It was our EMS training grant. It was usually in the area between 11,000 and 14,000. We have now been lumped into Service Area 6 with multiple counties. So that has decreased in allocation. Last year, we used the money to purchase one of our initiatives through the County EMS Association is to update the equipment and the mass casualty trailer that's housed at the Asbury Fire Department. So we did purchase some equipment towards that last year using the grant. This year we have $5,563 allocated from the region to the association. So we will be looking at how we want to spend that money, most likely for the mass casualty trailer to upgrade, as well as there's another project that we're looking at through the EMS grants. So again, that's an in and the out. We don't spend, the County EMS Association doesn't have a lot of money, so we don't spend over them what we get allocated through the grant for that. Okay. Next slide. The Dubuque County Multi-Jurisdictional Hazard Mitigation Plan is a very important plan for Dubuque and all the cities. It's valid for 5 years, so ours last was done in a process through in 2018. It gets submitted to the state, they approve it, and then it gets submitted to FEMA Region 7. And ours will expire in February 28th of 2024. So next calendar year or later this fall, we're going to need to start the planning process for that. It takes about a year to do that. By the time we get it approved and everything. Where this is important is any kind of non-disaster grants that any of the cities or the county wants to do, whether it be a buyout, such as the one that was up by Durango, or projects as big as the B branch. There's a flood mitigation project. So if we don't have a valid multi-jurisdictional hazard mitigation plan, we're automatically not eligible for some of them grants and funding. So that's something that last time when we did it, we were able to, 9 other counties in the state were awarded a contractor through the state that did it for us. Previous to that, ECIA was the contractor that did it. So I did reach out to the state to see if they were going to do that again, if there's going to be funding for a contractor. Otherwise, we'll have to work with ECIA or go about that to get that updated. With that, I think we have in there like $10,000 budgeted for income and expense, and that would be, a pass through, hopefully for the grant project. Moving on to the hazardous materials team 2080 agreement. That's our annual contract. The Dubuque City of Dubuque Fire Department responds for any major incidents in the county. Provide that hazmat tech level. The volunteer fire departments are trained to the hazmat operations level and support the hazmat team when they get there. If we do have an event through emergency management, I will collect all the costs and bill the spiller or the responsible party for that. So the overtime costs that the Dubuque Fire Department will incur, or the staff time that the volunteer fire department incurs, as well as equipment costs and the sheriff's office, law enforcement, any of their overtime, that all gets billed to the spiller and recouped through that billing process that's allowed at the state level. The contract is important because it allows for immediate response when needed. I have the FY22 numbers on there, and the FY23 number is slightly more. And how they break that up is they take all the expenses for the people that are assigned to that unit. So, and then they divide it by 3 because the 6 people that are on the hazmat truck also run a ladder truck, and they run a ambulance. And then, so that cost is then divided by 3, kind of on that 2/3 city, 1/3 county split that a lot of the other agreements that we have are on there. So that's just our regular contract costs there too. And then the next one is something that was approved, the hazardous materials vehicle. That was approved in FY21 and it was delayed due to COVID. Checked with Chief Steinis today, and it sounds like the truck should be here in the June timeframe. So this year, so we do have in the budget, there's $136,000 that was carried over from last fiscal year. And he's pretty confident that it'll go this fiscal year. Otherwise, with everything else and delays and how vehicles are, that may be something that we'll know a little closer on arrival, if it'll have to be, hopefully your support to put that into the next fiscal year if needed. So on the next slide, we just have we have a couple pictures on there. There's a picture of it, one on the one accident down south. And then on the next slide, Stella, is kind of the item drawings of what they're doing. So I think the total cost of the unit is going to be over just under 500,000 or close to that. So there was some increase in the cost, but your allocation has stayed the same with that. So hopefully June of 22 we'll see a new hazmat vehicle there. It replaces a 1998, I believe. So then on to the emergency management. Obviously, the Emergency Management Commission established 29C of the Iowa Code. And that law says that code section says that it's a member of the Board of Supervisors. So Chairman Potoff is on that, Sheriff Kennedy, and then the mayor of each incorporated city. So we have our budget hearing next Wednesday night out in Epworth, and that is the meeting that we propose the budget, and we need to have the elected officials there for the vote. So other than that, on the other meetings, the mayors can appoint, which a lot of them do, somebody to represent the city on the affairs of the commission, and it's normally the fire chiefs or somebody from emergency services that is on that. So we meet quarterly. Then the next slide is into the allocation. And so the commission is set up as a separate municipality by Iowa code, and how we fund it is we have a $39,000 grant, emergency management performance grant from FEMA that is passed through the state down to the local commissions for assistance with the program, mainly for salary and benefits. And then we split the rest of the allocation with the city and the county on basically a 60-40 formula, mainly off population when we did that. So then the county by state code provides all the fiduciary assistance, payroll claims, and everything with that. So the emergency management fund is set up in the county books. And the one thing that's different about it is at the end of the year, anything not spent does not revert back to the city or county budget. It stays in our ending balance. So, and that's key for being able to keep the allocation at the same level. So, and in the spreadsheet that since I think FY20 and through 23, we're anticipating asking for no additional increase from the city or the county for the emergency management fund. Next, some of the other thing with COVID, some of the money that came through a supplemental grant through emergency management, we're looking at, we have a grant for this year for 26,934, which one of the eligible expenses is to purchase a prime mover, they call it, of equipment and trailers, which we have quite a few out at the training center. And our plan is to be able to replace the 2005 Ford Excursion we have, as well as the 2002 International pull truck, and try to get one reliable vehicle to use for pulling the trailers and also for emergency management activities. Like, you know, we're still going to Cedar Rapids once a week for some PPE and some test kits. So that'd be a key vehicle for that. So that is on the horizon. We're working with the County Fire Association as far as that goes, and the Emergency Management Commission. One of the big things is Alert Iowa. We're working on transitioning from our Code Red service to Alert Iowa. I did have a meeting with the city clerks. They went to a new platform, Alert Iowa did, January 1st. So we're slowly rolling them out. Actually, our big notification went out yesterday with the city of Dubuque's odd even snow route parking. So there's some bugs in it. So we're working it through that, but hopefully here by midsummer, or we still are running dual systems. So we're under contract with Code Red through the end of the year. So, but we're going to be transitioning over to the Code Red, which is a platform by Rave Mobile Safety, which we're already using for the Smart 911 that the county has, that's operated through Mark's department and the 911 center, and also some of the panic alert buttons that are in the area with the schools in the city are also a Rave Mobile Safety product. So The EMA, going on to, and then obviously the multi-jurisdictional plan that we talked about, needing to update that as one of our important initiatives. COVID-19 response, participation obviously still continue on the incident management team. Although Sam and Mary Rose and Stacy are the smart ones, I'm not a public health expert, but as far as the logistics and the PPE, and I can help them wherever I can and try to do so. I mentioned that we are still going to Cedar Rapids for the picking up some supplies, and the Board of Health, just so we did take delivery of their masks that they purchased, they approved last week. So we do have them in stock now, ready to go. So the EMA Budget Committee will approved some information on a salary increase for FY 23 to 26 at the last meeting, and that'll be brought up at the as part of the budget hearing next week. So all that should be the revenues and expenses again will be at our budget meeting on next Wednesday before the 911 board meeting. So moving on with the Tom Hancock grant, again, thanks to the supervisors for supporting this much needed project. Kind of a rundown FY 20. We've had allocations of 125,000. 8 services were awarded grants first year, 7 services the second year last year, and then this year we currently had on the next slide for FY 22 we have 10 services that were awarded grants. And again, you'll show in the worksheet that FY 23 is 125,000 was requested through that grant. So on the next page, our next slide, our committee consists of myself, Mel White, Courtney Schultz, and Jill Black that were assigned by appointed by the supervisors. And then we have positions on there that change with the president of the Dubuque County Fire Association is Peter Hagginson. The Dubuque County EMS Association president is Andy Nye. And then Supervisor Potoff was appointed to that this year, I believe. So, but thanks to the past committee members. And then we have a couple pictures, and on the next 2 pages there, some very happy firemen and very happy people that really appreciate the opportunity to apply for that, and it really helps with their projects. Moving on to the next part of the budget is the Dubuque County Revolving Loan Fund. Right now we have 490,000 total in that. Services can get a $45,000 EMS loan with a 3-year payback, or a $50,000 fire loan with a 5-year payback. It's really working well since the supervisors had allocated a little more money for that fund. Right now we're sitting with 148,000 in the account, but mainly that's again because of the delays in some of the ambulances and some of the fire trucks that we're seeing, nationwide. So we have applications ready. The fire departments have equipment ordered. We're just waiting for them to come in. So it's not that the money's not being used. So I think the next slide, yeah, there we go. So yeah, we have 4 applications on file, and mainly they're just waiting for delivery of the vehicles and the final invoicing on them. So that's kind of the regular, before I go into the 2 ARPA presentations that we have, that should be the nuts and bolts of the Department 75, the ins and outs of with no major real increase or askings on that portion. So is there any questions on that before we talk about the other two?
Tom, I have a question about the Tom Hancock grant and,
Yeah.
and I know I asked you this when we met, as your committee members are fabulous, by the way. That is incredibly well done. So it was
Thank you.
very easy to be part of that. So thank you. But the question was about, we have an ARPA request for recruitment, a $600,000 request submitted for ARPA funding to Dubuque County firefighters volunteer recruitment. Actually, it's $700,000. Kevin Schmidt filed this. And so when I look at that Tom Hancock grant, and I know you explained that that is something that a department could ask for a grant award for. It doesn't have to be, you don't have to have a final answer today, but what should we be working on for recruitment? Is there something that the Board of Supervisors is not funding that we should be doing about that?
I'm not sure, Ann. I know we did have that discussion and there is different training grants that are out there. The federal government, FEMA has a SAFER Act, they call it, which some of the departments in the county I know have taken advantage of as far as recruitment and retention. I'm not so much sure it's the money or it's just the people and the time. We actually run into that, you know, when we talked about it at the county fire meeting in November. We had trouble finding an instructor to teach the firefighter one class. So it did not run this year. And so we thought, well, we need to supplement what the state pays for the instructor, and everybody kind of really said at that meeting, and Supervisor Potoff was there, can attest that it's not so much the money, it's the time commitment. You know, people, you know, when one of the instructors, Chief Tegas from Key West, was promoted, you know, he ran the class very successfully one year. And then once he promoted to chief, you know, he just doesn't have that extra time. So on that end of it, it's back to the point where, you know, not so much the money, it's the time and finding the volunteers, you know, and if you know what the trouble the businesses are having getting people to go to work for pay, it's, you know, you can multiply that by 10 as far as the volunteers and getting the services. And I think we're really seeing that first in the ambulance services and the EMS response, and you'll see stories about that. But it's going to be talked about again at the EMS Association, and I'm sure the fire chiefs will be talking about it as well. You know,
Yeah.
I don't know if there's anything you're not doing. I mean, you're supporting us with the Tom Hancock grant. There is money out there for EMS training. You know, it's not as much as it was before, but a lot of the departments, I mean, I know, just speaking from Epworth, I mean, it's getting the people in and having them commit for a whole year to go through the paramedic program is the problem. You know, so so far we've been lucky, but that's not the case everywhere. I mean, I think Dubuque County is really fortunate compared to other areas of the state too, with the great volunteer fire and ambulance services that we have, and there's a lot of dedication there yet. So,
Yeah.
But I mean, the call volume is getting ridiculous too. I mean,
Yeah, that's, you know,
It
I'm
is
home
a
and
time commitment for
it is.
the volunteers, for all the
Right.
training they have to go through. And a lot of them are young, they have families. I mean, it used to be if you could pick up a hose and spray it on a fire, you were a fireman. Well,
Mhm.
that's not the way it is anymore. You have to have the training, you have to have the certification. It's a lot of time for nothing. I mean,
Yeah.
you're not getting paid for it.
Right. And
Well-
one thing the state did last year, the legislature, they did raise our volunteer tax credit from $100 to $250 at the state level. So $250 is better than nothing. Or I mean, it's a lot nicer than $100. So I mean, little things like that help. But you know, if there programs and ideas that if we can come up with as the either the Fire EMS Association, you know, we'll definitely bring them forward.
I know Asbury, where I live, is looking at, it's in I think our 5-year budget to have professional staff. And I don't know, the call volume here is, I think it's over 320 calls a year. I mean, it's just about one a day. So how we budget that and again, how do you find the people, but even the professional staff? But I think Asbury's currently discussing how we're gonna make this happen.
Yeah, I know I think they were almost close to 500 calls last year. So I mean, it's, yeah, everybody's been very busy running a lot
Well,
of
I
calls.
stand corrected. Thank you. I
Yeah.
didn't realize it was quite that high. So
Yeah,
thank you.
last year was, well, if you say, even the Dubuque Fire Department, how many more calls they had last year was just astronomical. So,
And Asbury gets hit pretty hard just with sundown.
yeah, and
They're going out to sundown continuously.
Well, we also have a constant development of senior housing that can make a big impact too.
you know, and the nursing homes and long-term care facilities and assisted livings and, yeah, people are living longer, which is good, but they need more EMS care as well as hospital care, so. Okay, any questions on that? Otherwise, also Denise Dolan is here. She's our 911 budget director. Sheriff Kennedy, and then Mark Murphy from the 911 Center are also here for the discussion on our 2 ARPA requests. So the first one is the request we put in for the new 911 Center. We forwarded all the study, working with Wold Architect on that, but obviously the supervisors are well aware of what's going on with the 911 Center and our needs, the future opportunities, if there's going to be regional dispatching to put us in a place to capitalize on that. And, you know, we're just out of space in the 911 Center. And for what the study says for people that Mark would need, there's just not the space to do that. So we thought that the ARPA request would be a place for that. On the next slide, a couple pictures that they took, you know, show how cramped the actual 911 Center is with just 6 positions. And you have a storm roll through, or the 3rd of July fireworks or some big event. 6 positions, quite frankly, is not enough for handling all the calls. So obviously the couple times they were shut down with the health concerns over the COVID exposures. So just no room for expansion. And then obviously the location downtown with, you know, the possible flooding. So that's kind of where we're at on that. I don't know if we need to expand anymore. I know that you're well aware of it and options are on the table, or what. As far as the 911 board, I think is concerned, you know, we're all for working with the county and the city, or all the parties involved to find something, but we know it ain't gonna be overnight, so something has to happen in the future. So we thought we'd put that in to start the discussions anyway, so. Anything else on that, Joe, or anything, or just?
I guess the only thing that I think we need to keep in mind on this is, you know, this has been a need. It was an addressed need. It's in 2014. It's 8 years later. It's still a need. It's probably unlikely that we're going to get another infusion of federal money in this county to handle a project like this. And with annual increased costs in construction for not only materials, but also for the construction, you know, cost of workers, or you know, to create the project, it's not going to get any cheaper. So I guess when I look at this, it's do you want to take a large bite now and take care of it, or do you want to, you know, wait 10 years and have the cost be double what it is now? Either way, it's going to be a large number whenever we do it. So you know, I don't know
if it's something that, you know, the county can get with the city of Dubuque and make it happen, but the number is not going to get smaller anytime soon. So.
Thank you, Joe.
And obviously to address the elephant in the room on that, Sheriff Kennedy, there's other budget repercussions rather than just in terms of the way we are set up through our 2080 agreement. You know, there's creative thinking needed here because we are not the final decision maker on this. The city is a partner, and conversations there have been such that we have to renegotiate the 2080 agreement differently to get assistance from our equal partner. So that, I mean, if it were simple, it would be done, right? We all know that. And I've been in the room. Mark Murphy has been kind enough to show me this very situation, and I'm very concerned. You know, at this point, it's going to be whether there's federal money or it's debt. We do have to get to this. We have to get to this project. But you know, the 911 board is caught because you can't do any more without decision makers making decisions. And here we are again. I've been a supervisor 3 years, third year of budget issues, and nobody's talking about that 2080 agreement. And Tom, you just presented slides saying there's not anything you're going to change there. And I know you're not the decision maker on that, but not everybody's in the room yet. And I admire, Joe, that you talked to me about another way to think about this and another way to maybe, you know, get it done without changing that 2080 agreement. But it's just with all the moving pieces, that's a difficult one to take up more than just cost, because there's a lot of thinking through.
Yeah, and I agree 100%. I mean, it's not as simple as just putting a building out somewhere. You know, there are a lot of pieces that have to fall into place at the right time and be a good situation for everybody involved. You know, unfortunately, when it comes to that type of, I guess, decision, that's beyond anything that, you know, that I'm capable of doing. That's got to be done between the board and the city manager, or even the city council and mayor. But, you know, it's obviously not the sheriff's responsibility to see that 28E gets put into effect.
Right.
You know, I was in the room with Denise and with Tom when we tried to revise it 2 different times. And it was not to everybody's satisfaction the way we did it. So it's kind of beyond us, and it's to the decision makers' plate now to figure that out.
Well, can somebody give me my colleague, Harley Potoff, on camera? You know, we have a quorum and we can talk about this ARPA grant, and we have a quorum and we're in public. And so you and I are the people that are going to have to work on this 2080 agreement with the city to get this set up somehow. I heard you ask our budget director to look at those numbers and to look at another financing stream, right? To see if there's any other levy. I heard you ask that at one of our first, wasn't that the first meeting we had about budget?
Right. There is, I have talked to the city manager just regarding it. It's a tough topic because right now, city taxpayers are paying more for EMA services than the county taxpayers are. It should be under one levy, an EMA levy under the county, where the county takes care of all of it, because the city property owners are paying county tax and they're paying city tax. The city is paying 2/3 of the cost of the dispatch center. So basically the city taxpayers are getting hit double because they're paying the county tax and they're paying city tax. And the county is paying 1/3 of that. So in order to make it right, and trust me, I don't want to raise taxes, but we have to be fair to everybody. And the only way to make it fair is that the county would take over the dispatch or EMA, emergency management, and it would be funded through a county levy that everybody pays, which would raise taxes for county property owners, and it would probably lessen some of the tax that the city property taxpayers are paying. But again, we have to be fair to everybody.
Yeah.
We're here
and
for
I-
the people, not just county, city. We're here for everybody.
And you've probably talked to mayors just like me and fire chiefs. Maybe I don't have extensive contacts with fire chiefs, but many of them are the mayors. And they would welcome being in control of this, having the EMA be more fully engaged in supervision of a new 911 center, right? So I don't think there's a reluctance to do that. Maybe what we need to do is, as part of this budget this year, ask Stella, our budget director, to convene a work session specifically about this and not make it be in the sense of I understand the ARPA request to spend the $16 million increasing as we speak for the cost of a new call center, but maybe we do need to start looking at tax revenue for this or debt structure. There's more to this. We have to find a way to make this happen. And you and I are probably going to have to lead that conversation. I don't disagree. It's not fair that the city pays more. When I talk to citizens in the city about it, they don't know, they don't understand it. And all they would know is that they want it to work and they want it to be successful. They like that it works right now. And that's the secret sauce in the county. It works. And that's because of mutual respect, mutual aid. But if you and I don't set this somehow for research, it's never going to happen. We're going to be 6 years down the road again, just running around about this. The board's done all it can to change that 2080 agreement, not us board, the 911 board.
I've obviously been working on some other solutions, which, I mean, you're aware of that could possibly work for future movement.
Correct.
Looking at regional aspects, stuff like that. Some other counties do have EMA levies in place, and the money basically passes through the county and it goes into the 911.
Should we explore that more officially?
I think we need to be real honest. I really think we need to do that. I think the only way we're going to get this moving forward is we have to get this discussion taking place with the city manager, see how we can move this forward and help the dispatch out. I worked over at the law center. I know they're stacked in there. They need more room. It's in the floodplain. That's been a problem for quite some time. Obviously, if the basement of the law center floods, we're going to have a serious problem because that's where all the computer hardware is at.
And the phone lines.
And phone. I mean, you're going to be basically without communications.
No, and COVID hit, and then look at how those chairs, right? And they're just not even, there's probably, 3 feet between those folks, and I don't know what the filtration system is and such, but I think that it's time, and maybe there's 2 members of the Board of Supervisors. I'm not trying to disparage anybody, but maybe there's serious interest here in doing that. And whether you have discussion with city, with Mike Van Milligan, maybe we invite him into one of our work sessions to talk about this and to air that. We just can't stay here in the middle. I mean, I want to make a change, and I don't want to raise taxes either. Nobody does, but we need to get this right.
And can I make a comment?
Yeah.
I think you're dead on by saying that we need to have the city manager in the room as part of the conversation. Denise and Tom can tell you that, the 3 of us have kind of been in the middle of the Board of Supervisors and the city manager throughout this process. And, hearing, we're basically relaying messages between the 2 entities. You guys need to get in the same room, and you guys need to figure it out. We've done everything we can to try to figure that out. And it hasn't been to anybody's satisfaction so far. So now I think it's definitely time that that the three supervisors and the city manager sit down in a public forum and discuss this matter in an open and hopefully positive way.
I totally agree with you, Joe.
I totally agree too. So who's ever listening, who is our agenda setter upper, let's find time to do that so we can continue this conversation. Again, because it's going to take a few work sessions. The solution to this isn't even as simple as a one thing. There's each step we want to take compounds the problem because we're not fixing the financial piece of this, Harley. That's what I think. We're not addressing that equalization of cost share for this service.
Right, well, it would, to do it properly, there would be no cost share. It would all be under the county, under an EMA levy, which would cover all of the 911 emergency services. Because that levy would be spread out among city and county residents. Everybody paid the same.
Okay, well, then let's get, let's have Stella, if you can, let's start running some of that math.
There we go.
Yeah,
That's what I
and
wanted.
Yeah, what? Sorry.
Sorry, Ann, I'm here, and I can only keep quiet for so long. It's Denise.
Thank you. Thank you, Denise. Good to see you.
And you did exactly what needs to happen. I mean, you can talk with the city folks, but until there's numbers out there and what the cost is going to be, or, I don't know if Mark or I can contact the city budget director and find out what they figure the comm center is as dollars per thousand of their tax levy, which would be the lowering there. And then, looking at moving, I think the EMA levy would come out of general supplement.
no, it would be a separate
Well,
separate levy, a total separate levy.
Yeah,
Right.
yeah. So, and looking at what that cost would be to, what would the increase be if the county took it over completely?
So I actually did reach out to Carrie Johnson at the Department of Management and got a response from her today, which I've sent along to the board, but it would be general supplement. So our only funding mechanism would be under our general supplemental levy to do this.
Right, and it doesn't have a cap.
Correct. And it would be probably close to 30 cents at $1.5 million.
I thought their county had just a separate EMA levy on theirs.
I reached out to her. I forwarded that email to all the supervisors so you can see our conversation. But I've clarified with her that the only funding mechanism would be general supplemental or general basic.
Right, and I think it actually comes out of the general supplemental, talking to like Johnson County and Scott County that do it. But on the tax bill, it shows emergency management levy, so it's not showing, it's not showing, it's a county tax, it's general sup, but it's out on general.
Spaced out.
Right, so it looks like an EMA levy when they get their tax bill, so they know what they're paying for emergency management / 911.
Well, and the other thing that Denise pointed out, so currently the sheriff's office has, I think we budgeted somewhere around 575,000 this year or for FY23 to cover our portion of dispatching costs. That obviously would be then removed from our budget. So that 30 cents might not be the actual number. It might actually be a lower number because you're removing.
Unfortunately, you're talking different buckets, Sheriff. So your 525 under your budget is general basic, which will remain at 350. It would give additional funding for other projects. But to fund it fully out of the general sub, it would be 28 to 30 cents, depending on what the budget is today.
Okay.
So.
Well, you could go ahead and leave that money in our budget.
No, Joe, I heard you
Nice
offer
try.
it up. So yeah, that's a take back, right? So, but all the same, we're still gonna be looking at the final levy rate is what we always work to reduce is the overall levy rate. That's where we're at. And we've tweaked it in my 3 years. You know, I didn't get this gray hair being a supervisor, but in my 3 years here, that we've moved that back in each of those buckets. 350 is a cap, but we've moved back and forth. You know, MHDS is now gone, as Harley, you said just a couple meetings ago. What does that do to bring in another, where does that leave us with availability of funding for this project? And that doesn't even get to the next project we're going to talk about, which is radios. So, I mean, we just had a whole session on public health, and the citizens told us, change things. You're short there. We want that different. And I think that's what our professionals and the citizens are telling us about this very issue. We can't just keep kicking this down the road. We got to get it done. And sound like I'm grandstanding. I don't intend to be. I'm with you on this. It's just that, you know, it's the two of us having this conversation.
But that's where it was coming from with the mental health levy leaving. I was checking if we could start an EMA levy at a low rate now until, you know, and build up some fund that when we do the move, or okay, we got something to start with.
Yep.
But Stella was going to check into that, but I don't know if we could do that or not.
Do you know anything about that, Stella, how it moves the numbers? MHDS drops off. Like, where's my sheet here?
So MHDS is dropping off. That's about 39 cents. We have been shorting our general supplemental already to use that fund balance. So eventually we're going to need to have about that shift to general supplemental just to fund our general supplemental as it sits today. With our expenses today. So I would say this would be truly an increase in our levy of that amount over time.
Right, and that's a 2080, and then the debt service, which also is going down. And I'm not saying the debt service is easy to go get, but there's movement there to also do potentially, you know, the ARPA money is just not enough to do all this. It's not. So, but I think this is a good conversation to have. And how do we, what do we need to know to get ready to have a conversation with Mike Van Milligan?
I can reach out to Mike and see when he would be available. I don't have an issue with that. See if we can have him here at some meeting to have a work session discussion and see what options are available to us.
Then we'd likely just be using ARPA funding to make kind of a, you know, a down payment on something, so to speak, just buy down debt if we have to go that way. And I know there's things we can't talk about, the pieces that are moving, but you know, that's kind of frozen right now too. So let's have some more conversation. Let's just keep going. We've got time. We don't have to we need to at least set a direction.
Conversation, at least.
Yeah, I think the work session's the way to go, you know, to get everybody in here and talk about it and
We know it.
figure out what it is and, you know, where we're at and, you know, the financial piece of it. You know, the 911 board we're bringing everything we can, you know, we're not a taxing body. We just basically have the surcharge coming in, so.
Right.
And I know, I have another fundraiser.
Oh, yeah. More drive-through fundraisers to raise $20 million.
So, well, you know, we talk about, and I think you're spot on, but we talk about how busy the fire departments are in the EMS. Well, just think every one of them calls starts in that, where you're looking at the picture, everyone starts in that small room that is logistically just almost impossible. So what Mark and his staff do with what they have to work with is just amazing. So
Can I ask another question? And oh my goodness, we're after 4:30. But
Mhm.
you know, the regionalization topic has come up, and I know there's good value to being prepared. Otherwise, Black Hawk County will get the region, right? You
Well,
know,
you
that's
never-
my fear.
Well, the thing is, you know, you don't know, the other counties are having the same conversation. How are they gonna afford it? You know, so as they would look to us or look to regionalization, the technology is there more so now than it is 10 or 15 years ago. So, to be able to do that. So I think it's, you know, having the, we want to be the first, we want to be ready to do that if possible, because I mean, it'd be a benefit for us. It puts us into a better position with obviously having more dispatchers to handle our calls and the other ones as well. So I don't know, Mark, do you want to comment on that?
And just on the regionalization, I know like the state's already gone with the state phone platform, which most of the counties are going on now. So they're kind of setting that up. They do have 12 PSAPs throughout the state that are set up as backup, and we are one of those. We actually are the backup for the northeast corner of the state. So that's where we're kind of hoping that we would stay, you know, if it becomes regional, that we would have like the northeast, maybe a county south of us, but everybody north and a little bit west. And that's kind of the way that state has the phone backup system now, is that we do that now. So.
Thank you.
Yep.
Do you have anything else, Chief?
Yeah, well, you want to go on to the other one real quick? Are there anything else on our first request that? Otherwise, our next request that we put in is, when we started, you know, we did the backbone of the system, the radios, we started replacing our radios back in 2011, 2012, 2013 timeframe. And at that time, we purchased radios that we could use on our old system that would be able to be used in our new system. The actual lifespan of a radio, you know, that's on a person's hip is expected around 10 years. You know, when we put both systems in there, we were planning on being up on the new system in 17, 18 timeframe. Well, obviously it got delayed. So, but that really doesn't affect our radio replacement schedule, because they are like, you know, like that 10 years. So we're to the point now where 289 of our radios are in the place where 214 of them are older. There's another 75 radios that are going to be due for replacement here in the next year. And one thing, are they going to just all of a sudden at 10 years, do they just quit? No, they don't. But we need to stay on top of things, be able to replace them. Of them radios that we have, 79 are in law enforcement, between the sheriff's office and the small town police department, conservation department. 135 of the radios are issued right now to the volunteer fire and EMS services. The additional 75 on there. So we put in a request for 289 radios. When we replace a radio, we pay for the radio, the charger, and 2 batteries, and the antenna come with that. Any of the other accessories are up to the agencies to purchase on their own, just so the different needs, and the sheriff's office and law enforcement obviously use the radios a little different than a volunteer firefighter does. So that request is in there. We need to have a replacement plan for them. One of the other things we're finding out when we went to the new paging system, it's been talked about extensively at the last couple of meetings. We lost the voice capability on that. So our plan with the radios is we would be able to reissue them to volunteer firefighters. So what happens now is if you have a call and you get the initial page on the pager that they carry on their hip, if that person doesn't have a radio, it's tough for them to get the updates that the ambulance is getting. And in the volunteer setting, you know, it could be your neighbor and you go across the yard, you know, or go to your neighbor's house. And if it's a dangerous situation, or if it's say that they have COVID, the next thing you know, you're in the living room and talking to them, and they find out you have all the symptoms. So we're thinking that, you know, some of the volunteer fire departments don't have as many radios as some of the other fire departments. So we would be able to reissue these radios, and if they last 2 years, 3 years, 4 years, great. You know, since it's on our system now, there's not an access fee like there was before, so there'd be no additional costs, and we just use them and run them as long. So we really wouldn't, we'd be replacing the radios on a schedule, but we'd still be using them longer. And I think, you know, they say industry standard 10 years for a radio on the hip, but you know, we do a maintenance contract with Raycom. They're servicing the radios once a year, looking at them, tuning them up. So, and I think that really goes a long ways as far as our longevity of the radios. So that'd really help with one of the issues we're having on the volunteer fire and EMS side, getting more radios out to the volunteer firefighters too. So the request is actually kind of twofold. I mean, obviously it keeps us on our replacement cycle. And then being able to kind of assist and supplement the information that the dispatchers are given to the responders. So,
Geez, there's
yeah,
289 radios total in the county.
289 that are up for replacement.
How many are there total?
We have 640 roughly radios that are that we were paying access fees on now. Some of them are in the fire stations. I mean, the base stations last a lot longer. The mobiles and the fire trucks last 15 years, but to be quite honest, they'll probably last longer than that. They don't get the damage of, you know, that on the hip radios or the handhelds. So.
So if I understand this, 289 radios is that this is an important and an urgent need? Is this high need right now?
Yeah, the 214 of them, they're going to be to the point where they're no longer serviceable. They're not going to make parts for them. The other 75 will last a little longer, but they're going to be coming up on the 10-year lifespan. So the other ones we would reissue, but you know, some of them might only last 6 months and some of them might last 6 years, depending on who's using them. And as long as we can mix and match, and when we take one out of service, you know, Raycom would be able to use that for parts to replace the other ones. And, you know, it'd still be a reliable radio for somebody, but you know, that'll help us on two fronts actually.
And is the $1 million, you know, that with shipping, it's about $1.1 million.
Yes.
Is that the full need that you have currently, or is there some kind of go ahead?
Yeah, that would replace the 289 radios. So that would replace everything that was purchased in, I think, 2013 and before. So everything else would be from 2013 and newer. So
you know, Harley, is this something that we phase in, or did we get ourselves in a situation where there's no more feasibility? If we didn't have ARPA funds, would this be coming to us as a request for debt? Would this be coming to us as a budget item?
yes.
Coming as a budget item or debt, but.
And it's something that could be, you know, we could do half and half over 2 fiscal years too, if that's helps with the way the funding is too. But yeah, we would definitely, and this is a project that we're not able to take on with surcharge. The volunteer fire departments wouldn't be able to take it on, you know, for replacement. Obviously the sheriff's office, you know, it would be coming here for replacement of their radios. So again, it only makes sense to keep it on the same. And when we did this, you know, when we went to this system, or when we replaced these radios back in 2011, 12 and 13, we were able to get 3 Fire Act grants through FEMA. And the County Fire Association was able to match, you know, come up with the match on that, and to the tune of around, it was over $800,000 that we were able to get. So we replaced a lot of the last time when we had to upgrade, we replaced a lot of these radios through the grants from FEMA. So we were lucky there, you know, but I think the match did come from the county, right? The county supervisors at that time.
Is there any grants out there now that we could apply for to assist with this?
Not with the emphasis of communications like they were, because this was shortly, you know, when all the 9/11 money was hitting, so interoperability was the big keyword. You know, so that we kind of hit at the right time with the interoperability and stuff, but the Fire Act grants are still out there.
When's the
Annually.
next batch due then?
I'll have to, Kenny is gonna get me that number, but it should be relatively, I mean, there was years there, I don't think we bought any. I don't know, Joe, do you know offhand what your radios were? I mean,
What our radios?
yeah, other than these.
The radios, so we just purchased a bunch of radios through forfeiture and also through that first FEMA grant when COVID happened. And I want to say they were about 5,000 a crack for our radios. But I know like the radios we have for like the investigators and road patrol and things like that, they have to do a little bit more. So they're a little bit more expensive versus like the jail or fire, or, you know, they don't have to have as many functions. They don't have to coordinate with as many different agencies. So those are a little bit cheaper version as compared to what we get.
So the $3,600 each isn't right?
That would be a high number now. Right, but that is the quote that we have, and that's attached in the packet of what Kenny said to replace them. But at our last meeting, January 11th, there is even a less expensive model that could work for fire. So that would be a higher end number up there for what, you know, what we would need. So. But yeah, like the law enforcement radios, they have more functionality that they need, obviously, for some of the secure channels and that we wouldn't have.
Yeah, and like
I'd like to know when the next batch is due.
Okay.
I
Yeah,
think
and I
we
should-
need to start budgeting so much a year that when it comes, we don't get pounded like this, so we have some money to.
Yeah, I think that's on the next slide, Harley, somewhere, radio replacement program, unless I forgot to put it in there, but yeah, we need to do that, and we should have that number within a week. Kenny was gonna work on that for us, you know, get all the radios that we have on the system that are assigned to public safety with their date they went in service. So then we will know basically out for the next 10 years, which radios need to be replaced and at what time. So that's something we're working on to get that.
My ask would be that we work toward making this happen. And so I would ask Stella to work with people who are, you know, the budgeters. Maybe it's Denise, maybe it's someone in the sheriff's office, Tom, but let's get this answered so that we can start phasing this in, whether we do the first bite with ARPA funds or the second or whatever. But I would agree with you, Harley. I think it should be on a replacement schedule that we can commit to, so it becomes a budgetable item. That's what we should do. And if we've got an initial, you know, bite early because we got to do some catch up, then I'm okay with that. I don't know where the money comes from. You know, we can't spend all the ARPA money today, although it's tempting. But so don't you think we need to rely on some of our people to start? I mean, I think this is a project we should be moving on, whether it's ARPA or not. Assume we need to solve this problem in the budget cycle, and what's the answer then?
Yeah, and then this quote is from early August, so we'll work on getting an updated quote on that. And also now with the new information that Kenny provided with some of the other models that, you know, could work for the volunteer firemen, firefighters and EMS, we'll try to get a better number and get a better for you.
I guess maybe it kind of goes to retention, huh? Kind of goes to this whole recruitment thing. Maybe we should have our volunteers have what they need to be able to respond to calls. That seems, you know, instead of it. I'm good with this. I'm glad to know that it's a need and figure it out. Harley, what do you think?
Yeah, I know we have to figure something out, whether we do it over 2 years and we take half out of the ARPA funds, you know, and so roughly 500,000.
Doesn't the sheriff have that to give back? I heard him say that earlier.
He did say he had a lot of.
Only if you build a comm center.
Okay, so moving on, don't get scared on these next two slides. These are just some of the initiatives that are going on in the County Fire Association, the First County Fire Association. Our training center, the burn room replacements are, they were installed, the burners were installed in 2006. They run on Windows XP, and I know if Nathan's on, he's probably gonna fall off his chair, but when they did that, to upgrade the computers or to upgrade to the new systems, what they did was they went out and bought every XP computer that they could, and they have them in storage. So if one of them quits now, they just send out an old XP computer. So that's what we're dealing with. But anyway, we have a committee of volunteer firemen. You know, we know the system, the burners are getting to their end of life. But there's a few fire chiefs and some interested parties or guys that work on the burners. They're investigating future replacement options. So that would be a project, you know, that we would hopefully do jointly with the County Fire Association, the training task force, as well as the city and the county, whether to come through a, you know, if we did a Tom Hancock grant, if we applied that 1 year, I mean, there's just different talk about, or if we can borrow some money, but that's something that's probably going to happen in the next couple years, 2 to 3 years. So that's coming down the pike. As far as the EMS Association goes, I've mentioned it before, you know, the mass casualty trailer that's housed out at the Asbury Fire Station. Some of the equipment is outdated, so we're working on that. We did apply unsuccessfully for a DRA grant a couple years ago to replace the trailer. So that's something that we're working on as mass casualty. And then also we're talking, there's a project out there for supply replacements, whether it be like, almost like putting 2 vending machines at the hospital where the county association could, you know, purchase supplies that they use on a call, and then it'd be billed back to the departments. So we can, some of the more expensive stuff, you know, is outdating on us now without not using. So by being able to lump the services purchases together, it might hopefully help us. You know, some of the more expensive, like the AED pads are $125, $130, you know, and if they expire, you gotta get rid of them. So if we can buy them in bulk and put them up and share them, that's kind of what's going on. They're just, the committee just got appointed on that. So I don't know what that'll look like or the cost at the tail end with that. And then the next page is exactly what you just talked about, the 911 board coming to you with a radio replacement plan. So I'll work on that. Kenny's getting me the dates that everything was put in service. So we should be able to march out, you know, roughly 10 years from now, how many radios are due for replacement, and have a good idea with it. Right now, you know, the tower maintenance, we have included that in the budget. The consultants gave us an idea how much we should be budgeting for, so we're putting away for that, the towers that you own that we operate, and then obviously the 911 center growth and expansion that we talked about. So kind of where we're at with all the associations we deal with. And with that, my next slide at 459 is thank you. So, I mean,
Can I ask a question, Tom?
Absolutely.
This relates to something that Nathan talked to us about as part of his presentation, IT. And in Asbury, do you know, did they run conduit to the water tower? Do we have fiber there? Do we have that? Do you know? Because he was talking about being able to run conduit to our towers, and obviously, you know, we own those assets, but what about in Asbury? Did that get touched when we came through here?
Right now, our whole intent was to, you know, as our main frame was going to do the microwave, you know, because fiber can get cut. We've had that problem in the past, but I mean, obviously, as a backup, we do have fiber right now from the Law Center to our Center Grove. Because of the line of sight, we couldn't make that work with microwave signal. So we do use fiber. I think fiber would probably be a great backup, you know, if you know, a windstorm or the derecho would come through and it doesn't really, I mean, I guess it could knock the towers down, but more so makes the dishes move, you know, so it takes a little while to get somebody up there to realign them. But, you know, that could be, I would think we'd be able to use that as a backup, you know. The city should have, we're thinking there's fiber right close there in Asbury Road. But I don't think to the tower, not that we're aware of, Ann, at least not for our purposes at this
Thank
point.
you. Yep, thank you.
All right. I have nothing. If you have anything else, Ann?
Well, just while we're here, I appreciate everyone's presentation. It's good stuff to know. It's really good to see what we're facing. But do we have a clearly, this is me and you, Harley. Do you think you and I have a way have we articulated sufficiently what we want our team to do? So we're going to work together on getting the phones into a manageable format for us to look at budgeting and ARPA, right? The phones, but also we're looking for a joint work session with Mike Van Milligan.
I'll take care of that.
And we're still looking for Stella to get us more information than on some budget numbers for possible inclusion of, you know, we need to know if we take on that the 2080 agreement and that changes from a 60-40 split to being all county EMA, where do those numbers start to look at? Right? Is that the takeaway from today?
Well, I don't know. Well, it would give us an idea of what it's going to cost. I mean, it obviously isn't going to happen this fiscal year, I don't believe. I would like to see it kind of start that we could build up some money for, you know, that you'd have a little nest egg per se when we do make the move. So.
Well, yeah.
Stella said like 28 to 30 cents.
Yes, we've always talked about that the cost of operations is about 1.5 million, growing annually with employees and changes there. So I would say 28 to 30 cents would support that 1.5 million.
And this would be on everybody, right? TIF isn't
It would
excluded.
TIF would be excluded. It would be the general supplemental levy.
So the only thing excluded is TIF.
Yes.
Which is fair. I mean, not arguably, it took on ag land, it's everybody.
Are you good with everything, Stella? Or do we got you confused too, or?
No, I guess I don't know what you want me to work up exactly on what those numbers are. I don't know what you mean by work that up.
Well, I want to do both these projects. So how do we do that? So I'm saying to you, I want to do both of these. So how do we do that? How do we get the phones and how do we get 911? So I don't know for sure, you know, I don't know what I want you to do. I want you to get me to a solution that is inside, if not this year's budget, next year's budget, what pieces can we fit in this year? Maybe it's a big chunk of the phones, you know, strategically use federal funding for something. And that's what I'm saying.
We're talking about the radios, Ann?
I'm talking about the radios are in need. And then 911, we have to have a 2080 agreement discussion. There's a lot of pieces. I'm just saying I would like somebody helping us figure out solutions other than, you know, otherwise you and I are going to continue to have this conversation too. We need the budget director. If I'm not saying what needs to be articulated, then I need to know that question.
Okay.
And I guess Jay probably would want to watch the video.
Yeah. That sounded like he was going to, which is good.
Good. Okay. Maybe someone can send it to him, then let him know that it's, I don't think it was just, year over year budget issues.
Okay. I don't have anything else. Thank you, Cheese.
Thank
Thank
you.
you, Joe. Thanks,
Appreciate your
Mark.
support.
Thanks, Denise.
Thank you, everyone. I have to read you, the text says, "Thank you, Jesus." I'm listening to the closed captioning, I'm reading it and it says, "Thank you, Jesus." So I don't know if you thank cheese, I don't know, but it came through as "Thank you, Jesus." So.
Okay, so for budget purposes, I think that's all we have for today. We'll be back Monday afternoon at 1 o'clock with our next work session for budget.
And I believe the auditor wants us to adjourn.
Yes,
So that's a motion.
I will second. All in favor signify by aye.
Aye.
Aye. We stand adjourned.
Thank
See
you,
everybody.
Harley. Thank you, everyone. Thanks, Stella.
Thanks.
Thank you, Stella.